Dear friends, I'm very glad to open the conference. We have a big problem. And to help us to overcome this hard issue for the whole humanity. We have lots of people participating of different status, of different trades, from different countries. We're going to talk different languages. And of course, it's great. I'm the moderator of this conference. I'm Bishop of Varia, and I'm a head of the Department on Church Ministry and at the Patriarch Council of the City of Moscow, and I coordinate activity of our hospital priests, who do not have at the moment yet an official status, an official position, and the moderators of our conferences. The moderator of our conference currently is on the urgent business trip, and regretfully, internet is not working yet there, so we cannot let him to us. But once he lands, he will answer your questions. And will be help from the press secretary of our unit, member of the Joint Council, Russian Federation, Vasily Rulinsky. And we're thankful to the Minister of the Russian Federation for the assistance in setting up this conference, and I hope that it will help us and it will help us to provide more assistance to those in need of that help. I would like to read the welcoming words of the Most Holy Master of the Russian Patriarch Orthodox Church. The organizers of the search, right? Scholarship and organization. Dear brothers and sisters, thanks for participating in this conference and setting up. So we hope that it will provide peace, hope for those who fight for their health. And spiritual guidance is very important. Due to the help of God and the support of the state, we try to revive hospital ministry. In our and the visited patients in the so your experience will be very useful to find the resources and also to specify legal resources on activity of the church representatives in the medical and social facilities. I would like to call up all your works, the blessing of Christ. Wish you a fruitful work and assistance of our assistance in your very responsible ministry. Kirill, Patriarch of Moscow, and all Russian. And it was a welcome word of our Patriarch, but also during the pandemic, he participated quite actively, providing help to our patients. He helped in organizing assistance to the patients quite intensely, and we would like to help our Dear friends, to address our conference, received the greeting word from the Valentina Matvienko. She is a chairperson of the Council of the Federation, and this welcome address will be read by the first deputy head of the Russian Commission on Social Policy, Alexander Varfolomeev. Dear friends, I'm proud to read the great words of the chairperson of the Federal Assembly of the Russian Federation, Valentina Matvienko. Dear participants, so I'm sorry that we were not quite instantly managed to join you and continue what you were talking about, what you said, but considering the person whose greeting I'm going to read, I think it's going to be useful and necessary for those who are going to discuss that very important and serious topic today. So that's a welcoming word of the chairperson of the Council of the Federal Assembly. Dear participants of the conference, on behalf of the Federation Council of the Russian Federation, of the Russian Federation, and I would like to greet participants of that international online conference, spiritual care to patients in the medical facilities. This topic turned to be very important, not only in our country, but even all over the world, due to the spread of the new coronavirus infection, when spiritual and psychological care is so important to the patients when they stay in the hospital. During the conference, we're going to raise and discuss very important issues, like legal status of hospital priests, their interaction with medical professionals, providing access to priests to the hospitals, and also implementing the patient's rights for freedom of faith. And we should understand that spiritual care is one of the leading areas of activity of the social ministry of the Russian Orthodox Church. Discussing the international experience for the works of the hospital ministers will give an impulse to creation of the institution of hospital chaplains. It will make it possible to provide care, to provide spiritual care to the patients in the hospitals. I wish you good communication, fruitful ideas, and well-weighted solutions. Chairperson of the Federal Assembly of the Russian Federation, Valentina Matvienko. Thanks a lot, dear Alexander. And please tell to Ms. Valentina for all good words, for your respect, for all those good words to our conference. And also would like to thank you for finding time and giving attention to us. I hope that you will help us to promote necessary laws and regulations so the work of hospital ministers will have a solid foundation. Yes, we will work together, sure. So, dear friends, our conference would be impossible without the assistance of Tatiana Golikova, deputy head of the government of the Russian Federation. And now I suggest to listen to her video greeting words. So please switch on her video. Dear colleagues, I'm glad to welcome you at the International Conference, Psychological and Spiritual care to the patients in the medical and social facilities. I should say that she supported this idea from the very beginning, and with her assistance, the conference gained that important value for us, for our country, for our sisters, for the nurses, and for, so to say, for all the participants in that conference. Are there any problems? Dear colleagues, I'm glad to welcome you at the International Conference, Psychological and Spiritual Care to the Patients in Medical Facilities. We could work in the Zoom system, and still there are problems with Zoom. The government of Russia sets as one of its tasks to create all necessary conditions so the patient performance will facilitate. And in Russia, there has a successful experience of interaction of priests and doctors, which actually is witnessed by patients and medical professionals. The church assistance turned to be very important during the pandemic when patients visiting the facilitated it's October 20th, 2020, during the meeting of the President of Russia, Vladimir Putin, with the Patriarch of Russia and Moscow Kirill. They discussed the role of the Russian Orthodox Church during the pandemic, and the President actually approved the activity of hospital priests visiting patients with COVID. In Western countries, has for many years the institution of hospital chaplains who are responsible for assistance to patients and those treated in the long-term care facilities. Our country has a rich history of interaction of the doctors and priests and clergy. For many years, hospitals had their own temple, and this tradition actually was lost, regretfully, but these days, during the efforts of the Ministry of Healthcare of the Russia, Synodal Department, and the Ministry of the Support and Social Welfare of Russia, we do develop the hospital ministry. Here we take into account best practices from all over the world. I'm sure this conference will be useful for medical professionals, for social workers, and it will be one of the important steps to create institution of hospital chaplains as a territory of Russia. Government of Russia is ready to provide all necessary support, and I wish you fruitful work in that field. I'd like to thank Ms. Golikova, and we do care of the patients suffering at the hospitals. We see the work of the doctors who also need this help, and this access for priests will be organized and set properly. It will be of great help to our doctors, and it will also help to the patients to overcome that hard disease. And now, dear friends, I would like to give a floor to Lyudmila Letnikova, representative of the Ministry of Healthcare, and she will read the welcoming word of the Ministry of the Healthcare, Michael Murashko. It will be the greeting word to our conference. So, Lyudmila, please, the floor is yours. Good day, dear colleagues. Allow me to read the report of the Minister Murashko. Dear colleagues and friends, I would like to welcome all the participants of the conference, Spiritual Care of Hospital Priests, Chaplains in Hospital Facilities. Russian Orthodox Church historically played an important role, both as form and moral pillars of the society, and also issues of treating, providing medical care to the patients. Today, Ministry of Healthcare of Russia, along with the Russian Orthodox Church, performs works quite actively on very important issues like protecting health of our citizens, setting up spiritual values and providing care and spiritual help to the vulnerable group of the population. Cooperation of the Ministry of Healthcare and Russian Orthodox Church actually continued during the pandemic, when the visits of priests to the patients providing spiritual and psychological care facilitated patients' treatment and cure. And I would like to thank all the priests and volunteers for their works. It's the first time we have this conference at the international level. It will provide a site to exchange your experience. And here you will gather priests from various confessions, chaplains, doctors, representatives of the government, and researchers. I'm sure this event will be organized on a very high level. It will provide answers to many most relevant questions and issues, and set promising ways to develop the hospital ministry area. I would like to wish you fruitful discussions and strong health. Minister of Healthcare of the Russian Federation, Michael Murashko. Thank you.
Thank you very much for taking part in our conference, and we would like to pass to the Minister of Health our deepest gratitude, and we're very happy that he has full understanding of the role of a priest in help and assistance to our patients. And this is exactly what is happening at the moment. So, dear friends, our conference also hosts a number of international guests, people who come from different countries and who also help our patients. Now, we would like to invite the director of the European Healthcare Department, Hans Fluger, to make his welcoming address. You're welcome. Dear Deputy Prime Minister, dear ministers, dear guests, and dear friends, it is so nice to make a welcoming address today and to speak about the links between the spiritual, physical health. These links are really very tight, and what the world is suffering in the recent years, in the years of the global crisis, the life toll of which is over 1,300,000 lives in the European WHO region, just stresses this. In the Russian Federation, during the pandemic, Orthodox Christian priests were allowed to enter hospitals and departments of ICU in the wearing full individual protection means in order to visit patients and their families, as well as the hospital personnel who daily came across unprecedented challenges and unprecedented tragedies. COVID-19 opened up our eyes to the completely new world. It actually confirmed that there is no health without psychiatric, psychological, and mental health. And it also demonstrated it to us how religious priests and religious activists actually can give and bring comfort to the society in a way nobody else can do. Such spiritual support and spiritual guidance plays an important role within the system of health care, in the very heart of which there are people, our patients. Spiritual and psychological support is of fundamental importance for the care and service for our patients in the period of recuperation, as well as for patients who are dying from disease. Compassionate palliative care, as WHO defines it, is not only spiritual and somatic support, but also this is prevention of spiritual sufferings. In many countries, in Russia, for example, there exists very strong tradition of hospital priests. Russian Orthodox Church provides invaluable support to the most those in need, disregarding the gender, religious belief and social status. I mean, hospital chaplains who work quite tightly with patients. And I would like to express my deepest gratitude to all of you, because you continue exercising not only very important duty in the hospitals, but also in the local communities, but also you seed root seeds for the future development. Crises usually result in certain change. COVID-19 provided us with an opportunity to revise our understanding and our philosophy about the medical and social assistance, as well as the role of those who provide medical and other support. Today, it's very important to feel the impulse, the trend towards the provision of important changes. I would like to say that the roundtable discussion we are participating in today is utterly important for recognition, as well as the importance for the development of comprehensive approach to the service of patients and their families, as well as those who provide medical care and medical service for these patients. Thank you very much for the opportunity to be together with you. Good luck to you. So as I see it, this is a beautiful and absolutely beautiful address, and thank you very much for doing it in Russian. I would like to thank you, and also I suppose that we should write a letter of gratitude to this wonderful person for his speech. A great assistance was received by a conference by the Department of the Russian Metropolitan Ilarion, as well as his department, and he knows very well personally those who work abroad, and we invited many participants with his help and assistance. So I would like to invite our master, Sergei Zvonarev, to make a welcoming address. So, Your Eminence, most Reverend Father, please allow me to speak on behalf of the Metropolitan of Volokala, and Your Eminence, dear brothers and sisters, dear guests, I would like to welcome all of you, and I would like to thank you for participating in such very important topical event. But Jesus Christ, during his life on earth, healed many people, and when he sent his disciples, communicating with his disciples, he talked about the very important, great importance of
being sick persons are really susceptible to the good tidings on Christ, and the clergy should bring them through the good heart and words on the sense of sufferings. And today, His Holiness Patriarch Kirill personally visits hospitals and various social facilities. Our priests, they go to the red areas to provide care to those sufferings. With thanks to the hospital management for their co-working. These professionals understand that to treat bodily diseases, we need to treat soul. Their souls, and faith plays a very important role. The great role in developing the hospital ministry is played by the Synodal Department on Charity. It provides to the priests visiting going to the red zones, the protecting means, provides training, and finds volunteers to care of patients in COVID hospitals. Activity of the church during the pandemic was with thanks mentioned by the president of Russia. We're sure that fruitful hospital ministry of the church should be developed, should be regulated, and properly regulated. The good example is a multi-century institution of hospital chaplains in the Western countries. I hope that the conference will turn to be the very important stage to establishment of institution of hospital chaplains for good of people and for the good of Christ. Once again, I would like to wish you all the God's help. Chairperson of the Department of External Church Connections of the Moscow Patriarch, His Eminence Archbishop of Volokhovsk. Thanks a lot for that. And those lectures he read to our sisters, he participated in setting up the sister service. Those sisters who turned to be doctors, many of them continue to work in the hospitals. So his contribution is very important, and I would say very significant. And also the last with time, but not with importance, we would like to read the greeting word of the person who actually responsible to protect the rights of the consumers. The greetings of the head sanitary doctor of the Russian Federation, Anna Popova. During the pandemic, she was responsible for infections, security and safety, and we'd like to thank her that she understands that priests can enter the red zone. She develops documents, helping us to do our job. I would like to ask to read the greeting of Anna Yurna by Vasily Rulinsky, our press secretary. So please, Vasily, the floor is yours. Good day. The greeting of Anna Popova. Respected participants of the conference, on behalf of the Federal Service on Surveillance on the Consumer Rights and Human Well-being, I would like to greet you with the opening of the conference, Psychological Care and Medical Facilities. Today, improving the health of the citizens and providing accessible medical care and preventing of the infectious disease is one of the focus of our policy. The serious challenge was pandemic spread of the new new COVID infection, which resulted not only in a high burden to the healthcare system, but also required union of all the efforts from all the layers of the society to counteract this threat. Considering importance of spiritual care for believers, Rospotrebnadzor from the first days of the pandemic started to interact with main religious confessions, and first of all with the administration and with the heads of the Russian Orthodox Church. I would like to express gratitude to the Most Holy, to His Holiness of the Patriarch of Russian Orthodox Church, and as a Senate for the interaction and for providing us with assistance. Russian Orthodox Church, along with interaction of the Rospotrebnadzor, we adopted preventive measures and anti-epidemic interactions to prevent COVID-19 and its spread, both in hospital settings and in outpatient conditions. So priests could visit people infected or with COVID-19 or staying in isolation, which make possible to avoid infection breakthroughs. Rospotrebnadzor and Russian Orthodox Church actively interacted, considering the development of the epidemiological situation, to provide access for Orthodox priests to the various hospitals to do the services in the hospital churches. Russian Federation managed to halt development of the epidemic, managed to find time to rebuild the system, healthcare system, develop the first vaccine against COVID-19, but also finding this pandemic was associated with lots of problems. In particular, with all those anti-epidemic measures, we see the need for rehabilitation and various psychological interventions, prevention of professional neurosis, and post-COVID professional burnouts among medical workers who worked in the persistent overload situation. We hope that this conference will be of great help in resolving those issues. I would like to wish you fruitful work, strong health, well-being, and new achievements. Head of the Federal Service on Surveillance in Protecting Consumer Rights and Human Well-being, Head State Sanitary Doctor of the Russian Federation, Professor Anna Popova. Thanks a lot, Vasily. Anna was indeed in a connection with us, and all those measures suggested by the state, they were implemented by the church, and all our wishes were taken into account, and we had no conflicts, no protests. Everything was done properly and nicely. And situation now also is quite okay, but it was not always the history of Russia. You know, it's just like breakthroughs or breakouts of sexual infection diseases. Situation played differently, and we hope that currently we will continue to do it that nicely and calmly as we did before. And let's start our working part of our conference. Let's start it with a presentation, like a hospital service of the Orthodox Church. Hospital Ministry of the Orthodox Church. I would like to thank you all the participating, everybody who joined us, students of seminaries and medical schools, and priests and volunteers and doctors, and our volunteers and medical volunteers, and so many other people who feel the need to contribute into the issues of providing care to our patients. We'd like to thank Dr. Ms. Golikova and Mr. Murashko and Oleg Salaga and others who participate in this conference. I should say that COVID has influenced our relationships and meetings. Today, we have our meeting online. On the other hand, it uncovered so many problems that existed before. It helped to consolidate a good part of the society. COVID not only brought us trouble, sorrow, grief, and death, but also brought us hope. You see those wonderful words from the gospel. I was sick and you visited me, as the Lord said, talking about the last judgment. He likens himself to a man who is sick, and helping to the patient helps to himself. And in response to that help, he supports us. And you know that many doctors, many volunteers, when they go to the red zone, when they work there, when they see this grief and sufferings, they gain joy. The grief shed turn into the joy, and cleans up the soul of people of various things. I would like to, I'm grateful to all the foreign specialists participating in our conference today. In Western countries, the tradition of hospital chaplaincy ministry has not been interrupted. And I saw it in 2018. I traveled to Great Britain to learn about the English experience of hospital chaplaincy. It was very interesting meeting for me. I visited hospitals, and at those meetings with English chaplains, here you see my granddaughter who actually helped me with the translation, those meetings. And we found lots of interesting things, lots of new things we found about the new trainings. In the UK, chaplains as a part of the national healthcare system, and it's the same with other countries. The experience shows perspectives for high quality development of hospital ministry in Russia. Since chaplains work as a part of the hospitals, they got their salary, they got their qualifications and trainings. They're part of the team of the doctors and nurses working in the hospital, discussing patients' performance, and they're involved to help patients who are in depression, or in grief. And the church in Russia has played a key role from the very beginning in matters of mercy and charity. First hospitals, as you know, were opened with hospitals, and with the petition of the church, almhouses and hospice houses were created. Almhouses is like centers to help to those who are homeless, and from the mid-19th century, the activity of Sisters of Charity started to develop. These were people who devoted their lives to acts of mercy. It's not a specific feature of Russia. Similar ministries could be seen by women, like in other countries, like Florence Nightingale. Everybody knows, heard about her. And with these books were published in Russia. I found very lots of interesting So at the end of the 19th centuries, nurses entered the hospitals to help the doctors. At the end of the 19th century, Saint Righteous St. John of Kronstadt organized a workhouse for the neediest people. And in the early 20th century, Saint Elizabeth Fedorova Romanova, granddaughter of British Queen Victoria, created in Moscow the Marfa Mariinsky's convent of nuns, and herself sought and cared for the needy. It's a great example of uniting of the Western experience with the Russian reality. But gaining the Orthodox Church in Russia, she brought a Western tradition of charity into the Russian environment. Another granddaughter of the British Queen, passion bearer Empress Alexandra Fedorovna, together with her daughter, you can see them in this photo, cared for the sick and wounded during World War I. And she visited hospitals, and not only her, but many people like duchess, noble ladies. They wear the clothes of nurses, help to treat people, and they treat those in blood and with big wounds. And it's great that it would be great if our modern women would participate in that ministry. During the World War I, in the Russian army worked about 30,000 sisters of charity, and the active hospital ministry of the church was actively developing before the revolution. So widely and importantly, actually every large hospital has its own temple with the priests serving there, who regularly visited patients, comforted, supported, confessed, gave the confession communion to the patients. And it was important, those temples was that their parishes, but their main task was to serve, to provide care to patients and sisters of charity. You can see various large hospitals we started to develop in the Russian in the 19th century. At all of these hospitals were organized churches, and temples and churches were often located in the center of the hospital, like in the first city hospital, former Galician hospital. You see the church, and I'm actually ministered this temple. After the revolution of 1917, everything changed. The Russian history changed abruptly. The Soviet authorities forbade the church to engage in charity work. Priests were deprived of access to hospitals. And first, so hospitals which were destroyed, these were hospital temples actually, and hospitals, temples in the best case turned into the warehouses or outbuildings at best. Here in the church there was a canteen, there was various rubbish, and remember, as we cleaned it and tried to bring the church into the proper condition. In Soviet times, to get a priest in a hospital, you had to come in secure clothes. It was very hard. I had a friend who worked as a junior nurse in a hospital, and once she decided to work among the patients, asking if anyone needs the priest to visit him or her. And once the hospital management found about it, she was deprived of various benefits, and they couldn't fire her because it was very hard to find such a great, so to say, worker. And situation started to change only at the end of the 1980s, beginning of the 1990s. As I said, the Lord was so merciful to me. He helped me to participate in that ministry. These were so great, wonderful years. The sisters who came to the hospital, they're full of enthusiasm, lots of volunteers, and they still remember about this time as the happiest days of their lives. The situation was quite complicated. There was a shortage of treatments and drugs and staff in the hospitals. Christians from other countries helped us. There was some humanitarian help with food and drugs. And social activity of church started, actually was revived those days. And today, the church is one of the main organizers of charity in Russia. We're developing projects to help the homeless, addicts, people with disabilities, women in crisis, on the verge of abortion, families with many children, and low-income families. A special place is, of course, for the church is the minister of the church in hospitals, and it gained special value during the pandemic. When the pandemic began, we organized a special group of priests. You can see them. You see the priest being trained to wear on individual protection means, you see this online training. You can see the photo at the left, at the bottom at the left, and the other parishes also got those priests. There was a special lectures given to them. You see nurse helping to wear this protecting means, and with participation of His Holiness Patriarch Kirill and other archbishops, we develop rules for administering the sacraments to people with coronavirus in the hospital or at home. These rules provide for the observance of all sanitary norms, so nothing will be brought out of the red zone, and we specifically thought about how to do it properly. But at the beginning of the pandemic, however, we encountered a situation where priests were practically not allowed into hospitals. We had to turn to the Moscow City Health Department, to the federal government, and say to Anna Yurievna Popova. The situation has changed. I think nobody expected this terrible pandemic development. Everybody was scared and nobody knows what to do. And in hospitals, lots of believers before the death were deprived of their confession and communion, and their relatives died without the priest assistance. And regretfully, before the pandemic, it was also our we should blame ourselves as well. We did properly interact with public care facilities. We were always in a very good, so to say, connections, but nobody expected this terrible infection will develop in that terrible way. Not immediately, but some hospitals started to allow us in, and we developed mechanisms of interaction with the Moscow City Health Department. I would like to thank to the administration of the department, Svetlana Nikolaevna, but at the same time, there were hospitals, mostly federal and departmental, that were very difficult to get into, especially it was related to hospitals attached to federal medical schools, departmental hospitals, because they have their own rules and all administration. Since there are no written rules adopted at the federal level, quite frequently, we just couldn't agree with such hospitals' administration for priests to visit them. In many ways, the meeting between His Holiness Patriarch Kirill and President Vladimir Putin was a turning point. The president praised the Minister of Priests in hospitals during the pandemic and thanked His Holiness the Patriarch for organizing these activities. This meeting was a breaking point in the development of the hospital ministry. Special group of priests to visit coronavirus patients have appeared in many dioceses, in many parishes. You understand that the visit of the priests is very important. You saw what happened in the red zone. I wasn't there as a patient, but I just imagine what you can think when you're alone and naked in the ICU, where they remove all the everything from your body, even crosses, and there are people around you in very kind of a space-like suits. You don't see their faces, you don't see their eyes. It's very hard. It could be some dark, only some electricity could be lighting, and also devices blinking. Whereas it's a kind of with such a specific music, terrible music of those, so to say, probes and devices, and also it's very hard for patients. When they're all around, it's hard to communicate with them. I do remember first days, my mask actually, I had problems with my mask because I can see what was going on there, and it's very important to participate, to be able to receive the sacraments of the Church. And we did a training, online training, for our Moscow region, and since April of 2019, for more than almost 4,000 visits of priests were done to infected people in 57 hospitals in the Moscow region. So priests came in special protection means as well. We have a statistics on coronavirus visits by priests in Moscow since April 2020, and we see that during these days, most of the priests' visits were visits to people, to patients in hospitals, because in hospitals, of course, there are people who actually are in a very severe situation with a disease, and it's hard for them to overcome that. And in Moscow, since the beginning of the pandemic, we set up a telephone line recording all requests for priests to visit inpatients and people with coronavirus at home. We see the schedule of those visits. We see the statistics of those visits. We can see more people asking for priests to visit them. These numbers are only grown, and thanks God, we do not give fruits of those requests. In all cases, priests visits those patients, because sometimes there could be 20 or 30 visits per day, but our priests managed to do it. And also, I would like to note that our cooperation with the leadership of the city of Moscow, with the city healthcare department, is very successful, along with the Department of Labor and Social Protection of Moscow.
As today, the organization works quite efficiently, and it's not just the healthcare, but also the Labor and Social Protection Department of Moscow deals with us. They provide different sort of cleaning and also catering. This is an absolutely wonderful experience, and the work is so smoothly organized that it can be really praised. It is difficult times, but it's so good that so much is done for those people. And I'm very happy that we are part of this work and we are welcome in hospitals. We're very happy that we can actually help in this very grave and difficult work in this red area. And thanks God, in Moscow, in addition to priests, we also have Orthodox volunteers who also have been granted access to the red areas in hospitals. And many people listen to the priest, and the authority of the priest is utterly important for many believers. When a priest actually invites the other members of the diocese to come and help the patients, then this really works very beneficial. And also there are Orthodox volunteers. You can see Svetlana Nikolaevna here and Evgeny Petrovich, who also is part of this particular training for the volunteers. The volunteers, they help and help in the red zones absolutely free of charge. You can see the training in the center of the St. Alexis Hospital. More than 800 people signed up for such courses. Many sisters, many nurses understand how important it is to be part of this project. We do hope today that our conference will also listen. You will have a chance to listen to Maria Anatolievna, who, generally speaking, was received number of awarded. I mean, Mariana Anatolievna Lysenko, chief physician of Moscow Hospital 52, who is one of those people who supports this parish priest and volunteers movement, and she considers it to be utterly important, because volunteers sometimes notice something that a nurse is not capable of noticing because they're too overloaded with work, and very frequently they point to the issues and problems. I mean, the patient's care, not the treatment. Of course, they do not interfere with the treatment. So I'm very grateful for such cooperation. And we do not impose our faith inside hospitals. We do not preach in words, but in deeds. In this service, that is the foundation of Christianity. Even healthcare workers who were prejudiced against us in the very beginning changed their attitude. For example, they asked us how much we are paid and what is our reward if we get COVID-19. And we usually tell them we do not get anything. We're volunteers, so we work free of charge, and they get surprised. Because we are volunteers, and our wonderful volunteers, sometimes they're so brilliant people, so wonderful. I have my tears on my eyes when I speak about them, because there are people who are monks, who is a nun, for example, and also they have open hearts. There is a mother of mothers and also drivers, and many people from different fields come to be volunteers. Their work results in a great deal of respect from the hospital health providers. So they understand that these volunteers help nurses and really help doctors. The nurse is often called an advocate for the patient. I know this. Priest and a volunteer can be that kind of advocate. They do not actually protect or advocate his interests against the doctors, of course not, but they just additionally provide support because they have a chance to communicate with the patient directly and to sit at the bed of the patient more, especially when family visits are restricted, when no one close to the parent is around. Volunteers and priests are the people who can support and warm the patient for their care. Volunteers can now be admitted to hospitals in Russia. They will need a certificate of vaccination. Thanks to Anna Yurievna, we have this wonderful document which was provided. In order to get into the red area, we need to have a certificate of vaccination or a certificate of having had coronavirus within the last 6 months. These requirements are fixed in the recommendations adopted on the 30th of July 2021 by Rоспотребнадзор. Indeed, we must say that we additionally train our volunteers to work in the red zone, and every volunteer agrees on his activities with the administration of the hospital. Every volunteer also undergoes training and tests and verification until he gets into the red zone, which I must say that today the church helps not only people in the red zone, but also those who are affected by COVID, who have lost their jobs, income, and are forced to stay at home in isolation. In many dioceses, we also help families of those who lost their family members who undergo this stress of losing the close ones who did not see the last minutes of their relatives' lives and could not actually say goodbye to each other. We try to help them to overcome these problems. In many dioceses, since the beginning of the pandemic, food aid has been organized for those most in need. And our Synodal Department for Charity has launched a federal line of church social aid, which anyone can call and ask for help. On Channel 1, one of the leading TV channels in Russia, we organized a fundraiser for food assistance for people. Hospital ministry is one of the most important ministries of the church. By caring for the sick, caring them, helping and confirming them, we teach sacraments of the church. And we will fulfill the commandment of the Savior for the love our neighbors. I would like to say that presence of the priests in hospitals are utterly important. Doctors and nurses they have many responsibilities and they're overloaded with work. And they have their own potential, which of course is a restriction because there are cleaning companies, there are nurses, there are catering companies, but the volunteers and the priests, they provide spiritual guidance and support. Chaplains help staff to cope with the difficult situations and partly take the workload. And also they can provide psychological support to the health providers as well, because priests, they also can be partially psychologists, and they have huge experience in this because they know how to support people, they know how to spiritually guide people. The hospital priests are necessary because health providers are also people, and the person actually seeing suffering all around can get accustomed to it because this is a sort of a defensive mechanism. A volunteer comes over just once a week when he can do it, when he feels he has the opportunity and the strength to do it, and the doctors are forced to do it every single day. So of course it is not possible to survive there, and definitely they need some support. The hospital ministry of priests is necessary, of course, for the patients as well. Many Western studies confirm that clergy spiritual support has a positive effect on the well-being of patients. Patients themselves also tend to rate the quality of care much higher. And they even say that such spiritual support helps their health status. We have come a long way the last 30 days. Today, the hospital ministry of the church is being actively revived. And we understand that a lot depends on our relationship with the authority of the hospital. And we would like, of course, to develop this good cooperation. We're very grateful to all the doctors who meet us halfway, for those who help us, those who welcome us. But this good attitude is not always there. For example, in one clinic, I'm not going to tell you which one, the head doctor constantly refuses to access a priest even by phone. Although I am quite a respected person, not because of I'm for quality, just because of the status. I am affiliated to a number of committees, boards, of advisory boards, and as well as the foundations. And we cooperate with the health ministry, but he doesn't even pick up the phone. He doesn't want to meet and talk to me. And when we have to contact a person in this hospital, he refuses. And there is no chance to come to any agreement with him. And the priest, priests are not allowed into the hospital. We need actually to make a call to some higher board of higher instance body, and then he's given a phone call, and then the priest is let in. So it actually doesn't facilitate our work. The church hospital ministry should not be based only on the goodwill of the head of the hospital or the. There must be solid legal basis. That is why our conference is very important. There is law, there is legal, such word exists in the title of our conference, and this is something that gives us the basis for further work. So clergy in a hospital should not be mere visitors. There must be certain functions of chaplains, and in different countries they have different roles, and they're part of the medical staff. And there is systemic training for them, special courses. The hospital ministry of chaplains has a special character. In order to devote sufficient attention and energy to each patient to come to the hospital every day, the hospital chaplain must have time to do this. This means he must be spared of many other responsibilities. We do not take any money from the patients. This is something that must be understood. But we should understand that priests also have families. And if he works in hospitals only, then there will be no financial support. This is why financial support for the hospital chaplains is so important. In Western countries, chaplains are paid by the medical establishments and report to their bishops. It should be understood that the ministry of the chaplain in a hospital is not only the desire of the church to fulfill a Savior's commandment, it is also the right of a patient to have access to the clergyman, also to freedom of religion, which is stipulated in the Constitution of Russian Federation. And these rights belong to those basic foundations without which a full society and fair society is not possible. Now, in the final part of my presentation, I would like to speak English to be closer to our participants who are abroad.
So today we're going to hear Western experts speak on their experience in organizing church hospital ministry. This tradition has never been interrupted in their countries, which helped to set up and maintain a full-fledged institution of hospital chaplaincy. I expect our teamwork today will be of great benefit to help introduce your best practices in Russia. I am sure that the institution of hospital chaplaincy will soon be established on the canonical territories of the Moscow Patriarchate, and our conference will hopefully become a big step towards achieving this goal. Once again, I thank everyone for their participation in our conference. May God's grace be with you in your ministry of the highest importance. Thanks a lot. Thank you very much.
Now we're Switching
Yes,
back to Russian. Now, in Russian, speaking Russian, I would like to thank you once again. It is an utterly important day because this is my biggest desire actually to speak about this hospital ministry and to speak about the legal basis of it. It's been my dream for 30 years, so I'm very happy to have this conference today. So we're going to move on.
Dear friends, I would like to invite Chad Maxey, head of the program on hospital chaplains, on care of families losing their relatives, and the chaplain, Chad Maxey. I would like to ask you to give a floor for his presentation. We are very glad for this opportunity to hear our friends from another part of the earth. So the floor is yours. We're ready to listen to your talk.
Dobroye utro, tovarishchi kapelani. I hope that was somewhat understandable. Thank you so much for inviting me to participate in the conference here. And I'm just going to give you a brief overview of the chaplaincy in the VA healthcare system and the Veterans Affairs healthcare system here in the United States. And I would say that most other hospitals within the United States have a similar system with the similar requirements for chaplains. So I'm going to see if I can share this now. And I was just really amazed and very grateful for the ministry that's being provided there. That was just really awesome and just a beautiful, beautiful ministry that's being done there in Moscow by your priest and your volunteers. I'm trying to get this to present. There we go. Hopefully you're seeing my slides now. All right. So this is an overview of the chaplaincy in the U.S. Department of Veterans Affairs. I'm Chad Maxey. I'm a chaplain program manager for the Department of Veterans Affairs. So our mission actually began right after our Civil War, and President Lincoln promised to care for him who had borne the battle and for his widow and his orphan. And we do this by serving and honoring the men and women who are America's veterans. This is a large picture of the Department of Veterans Affairs. There are 3 administrations. The National Cemetery Administration, the Veterans Benefits Administration, and the Veterans Health Administration. And VA chaplaincy falls under the Veterans Health Administration, where all of our veterans healthcare systems are located. The Veterans Healthcare Administration is our nation's largest integrated healthcare system. And so as a veteran, I can go to any VA anywhere in the United States and get care there. And of course, we employ many physicians, nurses, chaplains, and many other staff as well. We have 4 missions. Of course, the first and primary is the healthcare of our veterans. The second is education and training. So we provide a lot of education and training for physicians, for nurses, for social workers, for chaplains. We work with local educational institutions to provide that education. The Veterans Health Administration conducts a lot of research in the areas of medicine and medical care, and we do quite a bit of research into chaplaincy and pastoral care as well. Our 4th mission, which has become more of what we do these days, is emergency management. And so we have deployments to places where they have natural disasters. And during COVID, we have assisted local communities when they have run out of bed space for patients to provide care for COVID patients as well. So currently we have about a little over 9 million veterans enrolled in the healthcare system and about 81 million outpatient visits each year. And then we do a lot of telehealth, and I'll speak more about that in a little bit. And of course, we have 46,000 volunteers that assist in the care of our veterans as well. So VA chaplaincy. So in our Constitution, it says in the first clause of the First Amendment that Congress shall make no law respecting an establishment of religion or prohibiting the free exercise thereof. And so our jobs of chaplains is twofold. One is to ensure that veterans' religious care, spiritual care is provided for so that they have free exercise, and also to ensure that that no one comes in and tries to force veterans to practice a faith that they don't want to practice. So our VA chaplain staff is 675 full-time. That's approximate because we have people coming and going all the time. And so, but somewhere around that number, 675 full-time staff chaplains. And then we have another 96 that are part-time chaplains. And many of these part-time chaplains are chaplains of faith groups where there are a smaller number of veterans from that faith group. These chaplains serve in 1,250 healthcare facilities across the United States. Most of our chaplains are assigned to VA medical centers. And so usually the largest number are there in the inpatient care in every aspect of inpatient care, whether it's the intensive care units or mental health units or substance use disorder units. We have chaplains located in all those. Spinal cord injury, we have chaplains there. So all of these areas, we have chaplains and work with teams of doctors there. We also provide care for outpatients, mostly by telehealth. We do have a few chaplains that are in outpatient sites, but most of that is done through telechaplaincy. You can see one of our healthcare systems there and one of our community-based outpatient clinics in the picture. And then in the center is 3 chaplains that were deployed in response to a recent hurricane. So we have pretty stringent requirements for our VA chaplains. There's a lot of education that's required for that. And so minimum requirements to become a VA chaplain, first is a Master's of Divinity degree or equivalent from an accredited educational institution, endorsement from a federally recognized endorsing body. And so that's a faith group that comes together to say, yes, this person is a pastor or a priest in good standing. And, you know, we endorse this person for service to our veterans. Right now, we have over 180 faith groups that endorse chaplains for the VA. Each chaplain must have 4 units or 1 year of clinical pastoral education from an accredited educational institution. And so right now there's 2 institutions that provide that, and I'll speak to that a little later. And then the last requirement is that board certification for each chaplain. And so there are 6 federally recognized chaplain certifying organizations. And so a chaplain has to apply there, and they go through, they have to write a series of papers and do an interview and show the work that they've done to get board certified. Once the applicant completes all those requirements, then they can apply for a federal position, chaplain position. And we do that through a website where they upload all of these documents and the resume. And then the resumes are reviewed and the applicants are interviewed and chaplains are selected. And we really have no difficulty finding good qualified chaplains for our positions. Once chaplains or VA chaplains are in the VA, we provide what we call continuing education. And so there's a virtual chaplain basic orientation course, which we call the core course. And it's a 12-week virtual course that prepares new chaplains coming into the VA around specific VA chaplain issues. We have our own electronic health record system. And so that's something that they have to get used to that's not accessible from outside. There's, of course, many training courses that have to be done as a part of this on how to care for veterans in the VA healthcare system. We emphasize research, what's happening and what's being researched right now in chaplaincy. Most of the training is done by video presentations, some from VA chaplains, others from physicians, social workers, psychologists, psychiatrists, interdisciplinary team members that provide insight into how chaplaincy fits into the interdisciplinary team and how we work together. And of course, there's a forum for questions and answers for these chaplains as they go through this, and they're grouped together in small groups with a chaplain mentor so that they get some mentorship and they can get their questions asked from that chaplain mentor. And that is outside of what they receive at their own VA healthcare system through their own chaplain service. Later in their career, usually 3 to 5 years, then there's the advanced course we call the CAVE, 12-month course for advanced chaplains that provides a lot more research, and they begin to then develop a specialty in a specific area. We'll talk a little bit about that later as well, but we have specialties in the area of like mental health, in hospice and palliative care, in substance use disorder, suicide prevention. Those are all areas where we have chaplain specialties. Of course, they get education in ethics and group dynamics and intercultural relations, research and suicide prevention. So when a veteran comes into the healthcare system, every veteran will not see a chaplain. We don't see every veteran that comes in the healthcare system. There's just not enough of us, and so we provide care as requested or in specialty areas. And so the first thing that happens as far as spiritual care is that there is one question that's asked by a nurse or a social worker, whoever interacts with that veteran, and it's a voluntary. The question is voluntary. The patient doesn't have to answer that, but to determine if there's a spiritual concern or a need that veteran has during their treatment. And then for veterans that are in our specialty care areas, and also veterans that express a need, then we do a standardized spiritual assessment, which is a tool that's been developed for an in-depth assessment of the patient's spiritual needs, distress, coping, and resources. And that, of course, is completed by chaplains. Once that assessment is completed, then the chaplain and the veteran together develop a spiritual care plan to assist the patient, the veteran, in their goals for spiritual growth or healing, or maybe renewing some spiritual practices, because a lot of our veterans are not part of a local faith group of some kind. This is completed again by the veteran and the chaplain, and it's shared with the interdisciplinary team. So we meet with the physicians and the psychologists, social work that are working with the veteran. Usually it's a weekly meeting where we talk about the veteran's treatment, and we provide information on the spiritual care. And sometimes veterans confide in chaplains things that they don't talk with their physician about. And sometimes we can assist the other members of the treatment team to understand what those concerns are. And then, of course, we provide resources, and we do follow-up visits as requested by the veteran. So COVID-19 response, and again, I was very impressed by your chaplain service COVID response. The pictures were just beautiful, and it was just fantastic, the ministry that you all provide there for your veterans and for your community at large. Just wonderful, and appreciate that. So for us, we do have in each healthcare system usually one or two chaplains that are designated to go into the COVID units, the sealed COVID units. Each healthcare system identifies those chaplains, and they try to meet the needs of the patients on those units. But what's happened really that's changed for us is that we've done a lot more telechaplaincy, what we call telechaplaincy. And so a lot of our spiritual care is being done by telephone or by other virtual means. At first, it was just telephone because we didn't have a lot of devices to provide for veterans. But then we were able to get iPads and things like that for our veterans so that it could be done virtually online, not only with the chaplains, but with other staff, social workers, as they were trying to develop more of a discharge plan for the patients, and for family members to call in and connect on Zoom or other platforms. The VA has a special platform that we call VA Video Connect, and that's what chaplains primarily use. And we do a lot of video spiritual care now, both individually and group care. And so the veterans have their devices, and we send out an email which has a link. They click the link, and everybody comes together. And we have been provided numerous spiritual care opportunities for our veterans that way. We've used the VA Video Connect and Zoom as necessary to connect family members with veterans while they're in the hospital. We also do virtual care for our staff. As was mentioned earlier, our staff carry an incredible burden during this time. And so we have started doing spiritual care and support for our VA staff. And we do that virtually. Every morning, we normally have a chaplain reflection that's provided for our staff across the healthcare system for those that can tune in. Those are recorded and can be viewed at any time during the day by the staff. We've learned to do virtual worship services and scripture studies. We do virtual memorial services. Again, usually in a chapel setting, but there's no one there except for the camera. And so that's been a new experience. We've started to train our chaplains. Also, we do have clinical pastoral education that we provide students preparing for chaplaincy within our healthcare system. We have 34 sites that do that. All of those sites have converted to virtual training modalities. And so that's been done as well. And then the thing that we've recognized for a number of years now is that even though we do have a chaplaincy, we cannot meet the needs of all of our veterans, spiritual needs or otherwise. And so we have been reaching out to our community clergy, our faith groups in the community to ask them and provide them with training and ask them to help support our veterans as well. And so that's more in the infancy. We have a lot more work to do on that, but that continues to grow as time goes on, and we expect to expand that because most of our veterans do not come into the healthcare system on a regular basis. And so that's my presentation. Again, I want to say thank you very much for allowing me to present today. And if you have questions, I would be glad to answer those as you're able to, I don't know, email me or whatever. I will provide that information for the
Dear Chad Maxey, we would like cordially thank you for the most interesting presentation of yours. It is really most interesting presentation. Thanks a lot. And thank you for getting up that early at 4 a.m. to take part in our conference. I'm afraid it was really not that easy. We also, of course, we had questions to you, but regretfully we're out of schedule, and we will ask Vasily to ask you the most important question, and the other questions we'll send you by email, and we do hope to interact with you further on. Thank you. So thanks a lot, Mr. Maxey, for your most interesting presentation. We don't have much time, so just one follow-up question. One of the participants said, what is the fraction of chaplains without spiritual, without any clerical status, either in VA system or maybe all over the states? So how many of chaplains do not have the official clerical status in your country or in your system?
No, we don't have any chaplains that don't have an official clerical designation. They all have to be endorsed by a clerical body, a church, a faith group of some sort. And there's a variety of those, but every chaplain is endorsed by a faith group. If you're asking about our veterans, about 30% of them don't report any faith affiliation, but we do provide for their care as well. A lot of times, because of their military experience, veterans know chaplains well because we have quite a number of chaplains in our military and feel comfortable talking with them and asking for assistance from them.
Thanks a lot, Mr. Maxey. And surely, would like, if it's possible, we will forward our questions to you, and we hope for further interaction. I would like to thank you for your most interesting presentations. Thanks a lot, and I would like to wish you all the help of our Lord in your work. Then I would like to ask Ms. Melita Vunovich, representing WHO in Russia, to make a talk. So, Ms. Vunovich, please, the floor is yours.
Thank you so much. Спасибо огромное. И Я перейду на
So I will speak Russian, despite the fact that I have my slides in English. So let me please put my slides on. I'll share my screen with you. First and foremost, thank you very much for inviting the WHO to be present at this conference, although this particular task seemed very difficult to me, quite challenging, because I was trying to look through the history of WHO and find some documents in order to find some adequate legal basis for the role of priests and spiritual guidance for the patients. But let us start from the map of the world. This is epidemiology map of the world. As of today, over 235 million confirmed cases of COVID-19. And all over the world, it's over 4 million, almost 5 million deaths. Here we have just official operative statistics, and I suppose that the number of deaths is even many more. Our director in Europe, where the Russian Federation also belongs, speaks about approximately total of more than 6 million deaths. These figures are awful, but more than figures, we can actually, figures cannot demonstrate the sufferings of people who come across physical sufferings, psychological and social sufferings, which are depicted here in these particular pictures. And in the very center is loneliness, loneliness of elderly people who suffer from COVID-19. And you can see in the right lower corner, you probably know the picture, is His Eminence, Bishop Pantelimo. I found this picture on the internet and I asked for permission to place it in my slide. I suppose that this is completely correct because it definitely reflects the topic under discussion today. The basic documents or key documents, dimensions of health of WHO that give us some legal grounds for the spiritual guidance in hospitals as the basic value, basic element, which must be included. So all the dimensions, all the key dimensions of health and elements of health definitely should be provided to our patients. What are the legal documents? First of all, WHO Constitution, which, as you remember, was adopted immediately after the Second World War, when the humankind went through large sufferings. After that, in 1978, Health for All, Social Well-Being Conference, which was organized in Almaty. It, for the first time, included the social well-being of a person as the main participant. And also we discussed health for the future. After that, the Executive Committee of WHO, in its report in 1983 and a resolution of 1984, in the draft resolution, clearly worded spiritual health and spiritual guidance. Further on, we see the development of these dimensions in the key documents, which allowed all the countries of the world, all the health systems, to look at the regulations and legal frames in order for the healthcare system to be element responding to all the needs of a man. In our archive, I found all these documents, the spiritual dimension, that was session 36 of the World Healthcare Organization Assembly, and after that, a resolution of 1984. The question about spiritual health as a dimension was included into the instruments of WHO, which started in 1988 and included the quality of life issues there is certain list of questions which seems to be utterly important. Mainly, why then? Because we had to handle the sufferings of people suffering from HIV and AIDS, and starting from this pandemic, we could not actually provide any assistance but symptomatic. Young people died, and spiritual guidance was utterly important at that period of time. It was an integral element of helping these people and compassionate care. Starting from 2015, resolution of WHO clearly states the spiritual guidance as an integral element of compassionate and palliative help. Compassionate help is must be integrated integrated into medical services, which is based upon patient-centered principles. So this is the help and assistance that should be helping people, not only physically, but also socially and spiritually, preventing spiritual sufferings. This is our global responsibility. Of course, this resolution provides us with clear recommendations to particular countries on how to improve the palliative compassionate care, how to improve the basic medical health, physical, psychological, as well as spiritual guidance. Of course, all this is utterly important because it is based upon the strategies of WHO and improves these strategies with all the strategies of participants of over 100 participants, and that means health for all, wherever it is needed. So we heard also Dr. Kluge, from Dr. Kluge, our regional director. His strategy was adopted last year in 53 countries of member states of the European region, including Russian Federation. This is United for Health, where psychological support and psychological health is valued as one of the flagship positions, having flagship positions, and together with this psychological health, but also is just one of the elements. So this flower includes many petals. And I would like to say that several days ago, we had a meeting on psychological health, where psychological assistance as an element of universal health services and as one of the key elements of responding to crisis situations, emergency situations that we see, and also an integral element of assistance that should be provided throughout the life of patients up to the end of it. So, and I would also like to quote from Hans Kluge: COVID-19 has opened our eyes. It has confirmed that there is no health without mental health in its widest and most comprehensive meaning. It has shown how religious figures can give solace and a sense of community, comfort, and spiritual support to patients and health providers. Such spiritual support does have an important place in the hearts of our people. Of course, sufferings and challenge always teaches us the best practices and shows us how to move forward. So first of all, its preparedness and response requires systemic basis, including legislation and regulation for the healthcare system, any system, to be enabled to be responsive to the needs and expectations of the people it serves. There is a strong tradition of hospital chaplaincy in many countries and in the Russian Orthodox Church. This is spiritual support to chronically and terminally ill patients and persons with disabilities, and it has been integrated into palliative care. WHO in Russian Federation is utterly grateful to the organizations and to the Russian Federation and supporting us in these projects, because this help is provided to everybody needed, disregarding the gender, nationality, religion, beliefs, or social status. So WHO expresses its appreciation and thanks to all who serve to people most in need in these times of unprecedented crisis. And I suppose we shall continue to support healthcare systems in order to integrate all necessary steps to ensure these services become a sustainable element of any health system and become a sustainable element of this system. So I would also like to express my personal gratitude, as well as on behalf of the team of our WHO office. I suppose that it's better to speak Russian, having my slides in English, so I apologize if my Russian was not good enough. Thank you very much for your Russian. It's been so warm and so hearted. Thank you very much for your work and for wonderful documents that you provided us with. Thank you very much, and be the mercy and help of God be with you. So also, Dr. Kluger, we are thankful to you. Now, dear friends, we know that for us in Russia, pandemic has been such a menace when there are and also there were so bad, the situation was so bad in Italy. I have many friends in Italy. There is a beautiful community that deals with different support to the and compassionate health, and we know that the volunteers are there. So we're very happy to invite the Roman Catholic Church representative, the representative of Vatican, Darius Gers. So please, you're welcome.
First of all, I would like to thank everybody from Rome. My Russian is not that good as with the previous speakers, so if I may, I would like to talk Italian. So first of all, I would like to thank all the organizers of the conference for being allowed to be present and participate in that most interesting conference. I'd like to say that it is very important, and in particular, I would like to thank the Bishop of Rea Pantelimon, head of Synodal Department on Charity and Social Ministry of the Moscow Patriarchate of the Moscow, of the Russian Orthodox Church, for his care of those in need and those who suffer, for everything they did during the pandemic. It's indeed very important what you do. I would like to welcome all the participants, and I would like to welcome the Patriarch Kirill and all of the representatives of the government of the Russian Federation and all those representing all the countries of the world who are here today with us. And I would like to switch to my presentation. Here's my PowerPoint presentation is in English, but again, if I may, I would like to talk Italian. Here I represent the Department of Ministering to the Integral Development of the Humanity. It was established by the Pope Francis, and one of the multiple duties of the new Vatican entity is coordination of the pastoral care in the field of healthcare. It means pastoral care means spiritual and religious care to those in pain and those suffering. I work in that unit. I represent that unit of integral humane development. And I would like to talk about the hospital ministry, about the relationships between Catholic Church and, so to say, state bodies, governmental bodies. I'm talking about the pastoral care in hospitals, about the interaction between the Catholic Church and public entities. This topic seems to be very simple. Can you see my presentation? No, we didn't see, regretfully, your presentation. So you don't see my presentation. Oh my goodness. Just one second. Just a second. Yes, I should press this share screen button. And is it on? Yes. Okay, finally. Okay, good. So I would like to talk about the relationships in hospitals. I would like to talk about this topic, which seems to be that simple, but it is actually not, about the interaction and relationships between the Catholic Church, the clergy, and the public authorities. I would like to share the experience of some countries participating. Here, we just heard those representing the United States, and I would like to focus on the experience of my department. First of all, I'm talking about the integral health concept, which is promoted by the Catholic Church. This concept, so to say, determines church activity in the health care. It covers physical, affective, intellectual, and spiritual dimensions of human beings. For us, health cannot be just limited with WHO definition only. It is not just the it's not just a status of full physical and psychological and social well-being. What we need to talk about the holistic health or integral health, because it takes into account internal spiritual realm. And in our department, we specialize in ministering to the integral human development. We prefer this concept of health, and we think that it actually corresponds to the Christian anthropology. We're talking about the promotion of the integral health. At our website, there is such a section called Integral Health. Here you can see various publications on the topic. For instance, quite recently, there was a publication on dedicated to the pastoral message to the World Health Day, and the Cardinal Peter Turkson said that we need to do a lot after the pandemic. We need to take another view on human beings and on the health. We should take into account physical, psychological, intellectual, social, cultural, and spiritual dimensions of the person. And those who care for the ill and suffering, they must have this overview, this integral view on care. So the chaplains should work for the holistic health of their, or integral health of their patients. So thus, the Catholic Church promotes and defends the right of every person to integral health. This is so-called holistic point of view, which includes both spiritual and religious care of patients. And I'd like to show some examples of pastoral care of the sick. We're talking about spiritual and religious assistance. It is impossible to think about that care without the spiritual component. So it should be, such care should be provided. And those which makes it possible to provide this spiritual care, this person violates human rights, and it's a violation of the new charter. There is such a document, new charter for healthcare workers, and I quoted that document, new charter for healthcare specialists of 2016. So I'm showing here the collective works publication, which provides opinions of the Catholic Church and healthcare with references to medical ethics and bioethics. This document has been translated into Russian. Coming back to the talk on interactions between the Catholic Church and public authorities, I mean the pastoral care in hospitals. Well, Catholic Church actually strives to collaborate with public authorities, including hard and severe situations. It's important to guarantee rights to the health and full-fledged care. We can give the examples of interactions with Catholic Church and public authorities in different countries of the world. There are countries where there is enforced an official accord between two parties. I mean, clergy and lay people. And here, in this case, spiritual religious assistance is guaranteed by the law, and hospital chaplains are provided for by the state, like Italy or Poland. And there are other countries where the government doesn't provide financial support to chaplains, but considers their spiritual assistance as an integral part of the healthcare system. These are countries like USA and Canada. And there are other countries of the type. So in Europe also, there are other countries which still, which have so-called memos or protocols on mutual understanding between the church, spiritual communities, and Catholic communities and public authorities. And the government of those countries do provide some financial support to chaplains. There are such countries in Europe where such assistance actually exists. So another example. There are countries having no official, so to say, agreements with the church, but there are in place some specific documents or protocols which makes possible to provide financial assistance to chaplains. But in these cases, precise compliance with precise standards is required. It is written in such countries like in England and Ireland. So the support to chaplains is clearly written in regulations, and there are clear standards. These protocols are adopted and signed by the state, by the government, and it's related to Catholic Church and other religious communities. I would like to talk about other countries, about other situations. There could be such situations in other countries where some health institutions are owned by Catholic Church, and then in such cases, pastoral care can take place freely, but it doesn't provide by the state, and the state does not provide here any support. It could be health institutions like outpatient clinics or university clinics. For instance, there's a Catholic university in Rome. We have similar hospitals in Africa. So such care actually guarantees and believers gain pastoral care in different countries, so to say, low and high income. And I would like to talk about other countries where only official state medical care exists, whereas no agreements between the church and public authorities, and the spiritual care assistance just depends on the benevolence of or goodwill of the government. And such case, we just cannot talk in some of those countries where we just cannot talk about providing spiritual care in hospitals because priests or so to say, clergy are just banned from being in the hospitals. If you talk about chaplains and their role in healthcare, we will talk about the places where their presence actually in places of care is permitted, where local bishops are to ensure that those in the chaplains are adequately prepared. And there are some specific basic requirements to professional chaplains: warm humanity, deep spirituality, competence, and specific training. And I would like to add to that one more thing. Today, it is quite clear that if untrained chaplain will come to the hospital, it will not be good. We should invest into the training to make this contribution effective. Pandemic taught us a lot. This person should be really actually prepared to that ministry. And I would like to stress, we bear a great responsibility. It's very important to provide proper care of the people in severe physical, mental, or spiritual situation. We talk a lot that mental care or psychological care is not that important. We talk about secularism, but COVID actually opened a lot to us, absolutely different situation. We see how it's important to help to those who sick or died. We should help also to medical workers. We should understand about the stress and remember about the stress of the medical workers. We should think about those who are next to us. We should, as chaplains, we should provide and care of people suffering, of those sick and in need. We should remember that we turn into closer people. This pandemic, as Father Marco Fabella said, we turn to be closer ones, closer to each other. And we should remember about the families and relatives, because they also suffer and it's also not easy for them. And chaplains really are able to provide such care. And we can help in different countries. We can really, in fact, provide such care. Even in case when it's hard to work, there could be executed protocols on mutual understanding to provide religious and spiritual care to everybody in need. So presence of a chaplain has a great value. It just cannot be actually valid. It's invaluable to assess those people sufferings and what is the role of a chaplain. It's a great help, great benefit for those who suffer, for their families, and for the whole society. Thank you for your attention, and let us try to do whatever it takes. Thanks a lot for your most interesting presentation on the ministry and importance of ministry, very deep thoughts on deep health. It's very important. We would like to thank you for that, and we wish you all the God's help in your works. Please send your best regards with whom we are in strong contact and work together, and those who fight in that terrible infection and work with all need all over the world. And today we'd like to switch to the talk about the service with chaplains in France. So the next talk is of the head chaplain of the medical healthcare facilities of France, Costantino Fiore. But first of all, I would like to say to our participants in YouTube, you can ask your questions in the YouTube chat. We will try to ask those questions at the end of our conference. So we expect your questions to come. Maybe we will not be able to do it today, but we'll try to do it anyway. So please, Costantino Fiore, please, the floor is yours. So there is some problem with translation, I'm sorry. So I would like to talk about the National Council, which organizes and sets up spiritual care in the hospitals. These are our staff, these are our chaplains, who work together as one team. And now I would like to switch to my presentation. So thanks a lot once again for being invited. As I say, let's do it, come on, as I say in Russia. Thanks for your invitation. So I'm a National Healthcare Chaplain at the Bishop French Conference. My mission is to follow up a network of 840 chaplains employed by French hospitals and more than 1,000 volunteers. In every diocese, there is a person in charge of local chaplains, which is in Coptic with me. And we carry our mission within the framework of the French laws regarding secularism and separation between the state and religions. But it means that the French state stands at a neutral position regarding religions. So it does not support any religion, any worship, but there are some exceptions for hospitals, prisons, and the army. French state could pay to chaplains, providing spiritual assistance to prisoners, soldiers, and sick people. So thus the state grants freedom of expression, freedom of worship to its citizens. And also state hospitals should remain religiously neutral, not giving any preferences to any religion. So therefore chaplains have to respect this neutrality. For instance, not acting in a proselyte way and do not distribute religious publications without the request from a patient. Besides, there are no official order to have a strong connection with medical staff, with nurses or medical doctors. In fact, we cannot visit a patient without a previous conversation with medical professionals. And of course, we should follow the rhythm of the medical facility, the internal rules and protocols. And summing up, I can say the chaplains in France, they actually have two authorities: the bishop, who assigns the chaplain to the mission, to the ministry, and the director of the hospital, or head physician of the hospital where he works. At the same time, after having setting up relationships with healthcare staff, we can be more attentive to patients. Doctors and nurses provide us with some background information on the patients, which could be of interest for us. Also, medical staff could also put us in contact with families which could need some support. For instance, during bereavement, we often organize such links. And I've got good relationships with many of our patients through the help of doctors or nurses who actually noticed that such patients require spiritual care, though patients might not request that directly. So this is we see this so say mutual addition of those works. So it makes to use holistic approach to see a patient holistically, integrally, and take into account various aspects of us as human beings. Special role of chaplains in the hospital is that patients often tell chaplains things which they will never share with their family. For instance, once a mother who lost her child told me that I can talk only with you about the death of my child. I cannot talk about that with my relatives. I cannot talk about that with nurses or doctors about that. So she was more open to me, and such link, it is based on the following. We should accept, we should sense a person, a human being, as an integrity of spiritual and physical. I already mentioned differences about the religious and spiritual needs. And of course, some people ask chaplain to come to pray and to talk about God, but others, they talk to chaplain about the sense of life, about the fragility of our life, about the sense of all those sufferings, and the question about the sense of life is one of the central religious issues and central questions in our life, and religion could help to answer that question. But we search for those answers initially in a more general sense, and quite often discussion of religious questions could be an empty talk if we do not talk about that in a deep sense. I would like to give an example from my experience. Which phrases, which questions we hear the most from our patients? It's from my experience. Where do we come from? Where are we going? Why should I live? Why should I suffer? What's the point to live if I'm sick, if I'm old, if I'm handicapped? What will become of me? Is there someone on earth who still loves me? Chaplain is called to listen to all those questions with empathy, without trying to bring immediate answers, even if the patient to say something.
Even if the person is not a believer, we still answer these questions. It is very important for the chaplain to speak clearly, openly, not to keep anything secret, and explaining to the person that the chaplain is not a psychologist, not a social worker. A chaplain must say it clearly that he is here to represent the church, and in the frameworks of this mission, he will be listening or supporting all patients, even if they are not believers. Chaplains are mandated from the bishop through a liturgical celebration. It means that all the church is involved in that mission. And when you have this assignment, this mission, we chaplains are never alone. We work in a team with other chaplains, religious or lay persons. All the people involved in the team mean that this is the presence of Christian community, the Christ on the hospital. So working together in a team is an opportunity to also share potential difficulties, to pray together. And I myself shared this experience very frequently with my colleagues. Brotherhood and common prayers help us to overcome difficult situations and keep hope. In France, when I speak to chaplains, I very frequently say that they bring people something special. For example, when a chaplain speaks about Christ, he speaks in the name of God, in the name of Christ. And you, chaplains, I usually tell them, should never forget that you are a vital link between God and patient. And this is your mission. During the pandemic, we observed many patients suffering of lack of relationship with their families, from isolation. Their families actually were restricted to get into hospitals. They were not allowed to enter to the hospitals, hospital units. And we noticed that chaplains became even more important. The presence of a health provider is very important as well, but our presence when we're not focused on medical issues alone is utterly important, and it actually shows that there are deeper issues, deeper questions, and we can view a person as one integral person. In France, we have Christian, Muslim, Jewish, and Buddhist chaplains. We try to build bridges and to keep the dialogue open between them. But we are Christians, and we know with our specific tradition, and we know that Jesus Christ, our Savior, never separated body healing from spiritual healing. As I've already said, healthcare chaplains or chaplaincies in each hospital work as a team, and we're small units of the church, and we actually feel the presence of church to keep sense of community. We have a specific tool which is called spiritual and pastoral analysis of the practice. This is our congregation, our common prayer, in the frameworks of which we pray together, and we also discuss our ministry. First, someone from the group writes about the visit with the priest, the situation, the dialogue, the feelings behind it, and we read this text together. We read it together, all our chaplains. Everybody can see the text, and secondly, we ask ourselves a question: how God entered in this visit? Which is the God's action during this time? We focus not on chaplain's actions, but on God's action by doing this. So, and as Jacob said after his struggle with someone unknown during the night on the Jabbok River, that surely the Lord is in this place, and I was not aware of this. This sentence returns in my prayer when I worship for my mission. And as a hospital chaplain, I can say in the end that our work allows us to completely differently look at the Christ's face in many different ways. I would like to thank you for your attention. I hope to keep in contact with you. Thank you very much. Thank you very much for your brilliant French communication and for your wonderful talk, wonderful participation, which is actually based upon very your personal practice. By the way, we have similar practices, and of course, we would like both in Russia and in France to get just certain payment from the state, because in prisons and in the military it is already done, but unfortunately not in hospitals. In hospitals, they are outside of the state realm, and I hope that it will return to the norm and we shall devote ourselves to patients. We do feel the presence of Lord. We say that the Lord is in the liturgy and the Lord is in hospital where people suffer. And we're very happy to be this bridge and to comfort people. We are happy that different religions, different confessions in different countries can unite in this particular liturgy, in this ministry, in this service. We have different doctrines, we have different liturgical and ceremonial dimensions, but thank you very much for telling this to us. So, dear friends, now we're going to move to United States of America, and at the moment, I don't know what happened actually. Something is not working, something is not functioning. Okay, I pushed the wrong button, most probably. Now we're going to move on to United States, back to United States. Yes, dear friends, now we're going to be connected to Stephen Wojtowicz, father and Orthodox priest in the Russian Orthodox Church in the United States, in Yale University, and also head of the chaplaincy. We are very happy to hear from you. You're welcome.
Vladiga Blagoslavi, Slava Isusa Christu. I would like to begin by expressing gratitude to His Grace, the Right Reverend Panteleimon, Bishop of Varaya, Chairman of the Synodal Department for Orthodox Russian Orthodox, for the Department of Church Charity and Social Ministry of the Russian Orthodox Church, for the opportunity to speak with you today. This is a great honor after having visited your country many years ago as a college student. I also convey the greetings of His Beatitude, the Most Blessed Tikhon, Archbishop of Washington, Metropolitan of all America and Canada. The present time of pandemic has put a strain on caregivers around the world, especially those caring for patients stricken with the coronavirus. You are right on target in focusing this conference toward the ministry of chaplains in these caregiving settings, as they offer much needed support to patients and staff alike. Research over the years has shown that those receiving pastoral care are likely to recover more quickly than those who do not receive this care. Clinical training in North America is reaching toward its 100th anniversary, beginning in 1925 with the Year of Theological Inquiry. Divinity School students at that time were invited by a physician in the hospital to experience theology at the bedside, hence the term clinical. While standards would later be developed, the focus of meaning making remains at the core for those who suffer and for the caregivers who tend to them. Clinical training offers a threefold journey of action, ministry to the patient or staff member, and your slides just so well depicted from your report, Bishop Panteleimon, the ministry occurring in Russia. Reflection in a structured peer group process with a trained supervisor, and renewed action, employing learning in further ministry encounters. After encountering a form of clinical training through seminary field education in 1989, I sought formal clinical training, first being certified as a chaplain, later as a clinical training supervisor or CPE supervisor, conducting clinical training programs. To navigate this field, endorsement was required, and we then had no mechanism beyond one's relationship with his or her hierarch. Not knowing if one could be an Orthodox priest and clinical training supervisor, I completed a Doctor of Ministry degree at St. Vladimir Seminary while continuing training, building within the dissertation a sacramental context for ministry and reviewing existing endorsement processes toward constructing the one presently in use in our church. Our Orthodox Church in America Office of Institutional Chaplains began in 2003 with our first formal endorsement and has been in office since 2006. Our endorsement process was developed to work with existing clinical training standards and credentialing body requirements so that our endorsed chaplains could compete alongside those from other faith traditions for chaplaincy positions. In brief, those requirements include a Master of Divinity degree or equivalent and 1,600 hours of clinical training. Endorsement is site-specific. So one is endorsed for ministry in a particular ministry setting, not at large, just like clergy are assigned to parish context, specific parish context. Upon receiving a job offer, one who has completed these requirements can apply to be endorsed. Typically, hospitals require all of these elements for employed chaplains. Hospice and long-term care may accept candidates with less clinical training. We currently have about a dozen certified men and women endorsed through the Office of Institutional Chaplains who serve in chaplaincy settings such as hospitals, hospices, and long-term care. We did have a federal corrections chaplain until his retirement several years ago. These men and women are dedicated to ministry in these pluralistic settings, even as they continue their participation in the sacramental life of the church. We also used clinical training elements in responding to a church-wide initiative in 1999, building a seminarian parish internship program that ran for several years. The OCA is presently reaching out to collaborate across jurisdictional lines in building a best practice model for endorsement for our American Orthodox Christian chaplains. In the American context, the chaplains can be certified after serving for a period of time in an employed capacity. Endorsement is also required for those seeking certification as a link bringing together a specific ministry setting, the chaplain, his or her faith tradition, and the credentialing body through which certification is being sought. In directing this office, I have developed the term clinical endorser to reference those of us as endorsers who continue to serve in a variety of chaplaincy and chaplaincy training roles, in part to best advocate for our chaplains. Few endorsers are themselves active in the chaplaincy arena. It has been my goal to support Orthodox Christians aspiring to chaplaincy service through endorsement. In doing so, it has been meaningful to present to and serve in leadership capacities on the boards of roundtables for pastoral care, both nationally and internationally, in many cases solely representing the Orthodox Church. And I would be happy to share more about these bodies where much can be learned about pastoral care and the relationship between faith tradition and institutional care settings. It is this author's thesis that clinical training remains the most effective means not only to train, but also to support chaplains in their ministry. The chaplain's own life journey, their faith tradition, and growing pastoral skills are brought together in the course of active ministry to specific persons facing struggles. In this brief opportunity to share, I would like to introduce a concept that may be of interest in your present exploration, that of indigenous clinical training. If we return conceptually to the year of theological inquiry in 1925, there were no standards yet guiding that clinical ministry. Those overseeing clinical pastoral care worked together with those engaged in it to build the model of clinical training in use in the US today. That is also the product of our American cultural context. I was blessed to work with mentors and colleagues who understood the value of the very origins of clinical training. One was of Dutch descent, whose parents were missionaries in China. Another was sent here from Malaysia for theological training to return and teach, only to have that teaching opportunity given to another when he arrived here in this country with his wife, young child, and $500. These men worked together with those interested in clinical training all around the world. I have traveled to some of these places and working alongside of them, supporting those building culturally contextual clinical training through lessons learned from my own experience of engaging clinical training here as an Orthodox Christian. As a bit of a pioneer or explorer navigating the uncertain waters between our Orthodox faith and its long and venerable history of pastoral care and our American clinical training context, it has been my greatest joy to work alongside these men, now of blessed memory, to develop unique models to a variety of cultural contexts. It has been my hope to have such a conversation around clinical training model within our Orthodox Christian context as it is occurring today. I say this again to underscore my gratitude to have the opportunity to share these thoughts today with our older sister Orthodox Church and all of those gathered in this conference. The closest point achieved thus far in the American context is the completion of an accredited unit of seminary-based clinical training at St. Tikhon Seminary in 2018. These students directly connected what happens in church and in the classroom with ministry at the bedside. Before closing, I would like to share two brief theological images that have guided this priest chaplain's journey in clinical training alongside parish ministry. The first is the journey of Luke and Cleopas on the road to Emmaus. Though we as Orthodox Christians often stop reading at the point of the breaking of the bread, it is important to note that Luke and Cleopas journey back to Jerusalem at that very hour to share all they experienced as their hearts burned. The sacramental frame of ministry connects the "let us depart in peace" at the end of the liturgy with "blessed is the kingdom" of the next celebration of the liturgy. With the experience of the Eucharist and the liturgy, we go out into the world to exercise the gifts and talents God has entrusted to us through our baptism and chrismation, and we bring the fruits of that ministry back to the next celebration of the liturgy. The second image has been of tremendous value to this author in navigating the challenging waters of clinical training as an Orthodox Christian, and has been a critical image in remaining grounded in our Orthodox Christian faith, even while ministering in pluralistic context in the chaplaincy arena. This image was included in an article published in the Journal of Supervision and Training in Ministry in 2002, bearing the title Pastoral Training in the Orthodox Slav. I am a descendant of Orthodox Slavic ancestors coming from Galicia. The image is that of Joseph in Egypt. We know that his journey to Egypt seemingly included one disastrous moment after another until Joseph finds himself in Egypt. He does not, however, surrender his Hebrew heritage there, but maintains with integrity his identity while being of service in this new cultural context, here in clinical training and chaplaincy ministry. Reflection on Joseph in Egypt has been incredibly helpful to this priest chaplain's sojourn in the clinical training context. May the servant ministry of our Lord Jesus Christ through the power of the Holy Spirit guide the Russian Orthodox Church in her present efforts to support those who are suffering during our present pandemic. May we continue to pray for and support one another during these most trying times. Spasiba.
Dear Father Stephen, thanks a lot. We see there is a late night. We see at your window. So you also woke up at 4 a.m. You also made a great sacrifice. And Chad has a very nice view behind him, and you shared some very interesting ideas. So it's very important for us to work together. We would like to talk to share what you are doing to share with those who can understand us. We would like to thank you a lot for that. Dear friends, we should change our agenda a bit. We do expect the talk of one of our speakers. We have Min Kite Hilbrun from UK. So she's the head of the chaplain service of Guy Foundation of the National System of Healthcare of the UK. So Ms. Kite Hilbrun could be only with that time with us, and I think this talk will be most interesting for us. So please, the floor is yours.
Hello, can you hear me? Yeah, okay, lovely. And are you, excellent, excellent. I presume that means yes. And can I ask as well, are you able to see the PowerPoint?
Yes,
Yeah.
we can see that.
Okay, thank you. So good for me, good morning. I don't know what time it is there, but here it's about 11:30 in the morning. And it is good to be with you today. Thank you for the honor of inviting me. My name is Mia Kite-Hilborn. I am an Anglican priest, so that's a Church of England priest. And I have been ordained since 1989, so I'm an old lady now. And I have been in healthcare chaplaincy for about 25 years, so a long time. And here at this job, my current job, I've been here for 20 years, so a very long time. So too long really, but hey ho, it's a long time. So it is an honor to be with you, and I bring you greetings from the Southwark Diocese, which is one of the dioceses of London for the Anglican Church of England. And I also bring you greetings from the Archbishop of Canterbury, who is the head of our church, who is currently, I believe, with Pope. So if he knew about us, I'm sure he would also give you greetings too. So these are the main hospitals. We have a lot of hospitals, but these are the main hospitals of the Trust. Guy's Hospital is the world's tallest hospital. We believe it's 40 stories high, 40 stories. So it's very high. It's next door to the Shard, which is the tallest building in London. And we discovered after 9/11 that people didn't want to be in Guy's. They were too frightened to be in tall buildings. And so although we have a 40-story building, we don't have any wards in the tower. All the wards have been moved out into lower buildings, into not so tall buildings. And instead of that, there's dental and research and all things like this that take place, outpatients in the 40 stories. This is St Thomas's Hospital here on the right, and that's where I'm speaking to you from right now. I'm in a clinical room, which is why you can see masks behind me for COVID masks. I'm sitting in the COVID mask storeroom. This is opposite the tower, Parliament. Our Parliament is here. So this is Big Ben and the Houses of Parliament. You can see there on the left. This is the River Thames in the middle. And literally opposite is St Thomas's Hospital. So I'm speaking to you from this building on the right here, right now. This building, this lower building, you can see it looking out onto the sea, that is our chapel. Originally, this was 9 blocks right the way up to the bridge, but because of the bombing in the Second World War, all this part of the hospital was destroyed. And so this is all what we call modern. It was 1950s. And this bit is the Children's Hospital, which is Evelina London Children's Hospital, which is just about to be rebuilt because it was built too small. So it's a big, big trust. Then we also have two other big hospitals in the trust. One is called the Royal Brompton, and one is called Harefield. And they're all specialist heart and thoracic hospitals. So these are the hospitals that we look after: St Thomas's, Guy's, London, Evelina London. Community sites, we also work in the community, and the Harefield and the Brompton. We have 22,000 staff on payroll, and then we also have another 1,000 to 2,000 that are bank who come in casually. We have about 3 million, well, probably more now, patient contacts. That was the year before last. So it's a big, big hospital. Our footfall is about 6 million a year in St Thomas's alone. So big, big numbers of people that come in. No, not so much with COVID because they can't come in at the moment. And we are strongly linked in partnership with King's College London. So it's a massive teaching hospital. And also another university called London South Bank. and we do teaching with both of those, and we also do training for chaplains with both of those, but mainly with London South Bank. We are a multi-faith and belief chaplaincy team, and that means that we have people from many different faith and belief communities, some of which we link with and some of which are employed by the Trust. So our regular team is about 7, I think it is, faith and belief communities, Christianity being one of those. But under Christianity, we don't have anybody from the Orthodox tradition at all, not because we wouldn't like it, it's because they won't join us. They prefer to work on their own rather than joining a multi-faith and belief chaplaincy team. So from Christianity, we have Anglican, like myself, we have Roman Catholic, we have Free Church people, and we have Pentecostal people. So those are the main ones. And in this part of London, we have the biggest people groups would be Christian. London is about 49% Christian. That's the latest figures that have come out. And it's about 14% Islam. And it's about 24-25% atheist. And then everybody else. So Jewish would be about 1.2%, and Hindu is 2%, Sikh is about 1%, pagan about 2%, things like that. So that's what we do. We have links with all of the faith and belief communities that are in London, so that if necessary, we can bring somebody in for the faith and belief community of the patient. London is a very, very multicultural city. Probably the most multicultural city that you will ever find, I think. It has hundreds and thousands of lots of different people from different communities, and each hospital, I know, like in New York, I've done some training in New York, and there you might go to a Presbyterian hospital or to a Jewish hospital or whatever. In London, there's no such thing. Every hospital is for everybody with the National Health Service, and you can't turn anybody away. So it's slightly different. We have an annual report. These are some of our chaplaincy team. You can see they're very, very mixed. That's me there. We've been doing a lot of virtual things. So on the bottom left there, you can see we do various virtual events, and that's our imam, one of our imams there. We have, I think, 6 imams in our team. Our team is about 150 people, 150. About 50 of those are volunteers. And regularly coming in every week. We have about 40 people every week, and then the others come in when we need them. So it's a big team, big chaplaincy team. And as I said, I've been in charge of it for about 20 years now. When I started here, there were just 4 chaplains. So we've grown it hugely. It's much different now. This person in the middle here, he's one of my deputies. I have 4 deputy chaplains. Team leaders, and this gentleman is an Anglican, this gentleman is a Muslim, this gentleman here is a Pentecostal, and I also have another black Pentecostal as well, who are my deputy team leaders. And then we have various other things. The picture that you see there is Florence Nightingale, because this is St Thomas's is Florence Nightingale, if you've heard of her. It's her hospital, where she set up the nursing school here. So I am the chaplain to the Nightingale nurses, and they meet regularly. So our chapel, our hospital chapel, is actually the Nightingale chapel as well. She's lovely. Doing an event with them yesterday. So this is the chaplaincy team. This is the sort of thing that we have to produce. We don't have KPIs, so I don't know if you have those. They're called clinical indicators or key performance indicators, but we have to create our own, and we have to show our activity level. Sorry, somebody's trying to get hold of me. I keep putting the phone down. And so we've had around 25,000. This is during COVID, so our numbers have gone down dramatically in COVID because we haven't had our volunteers in. So normally we would see around 40,000 patients a year. And this time we've gone down to 25,000 with COVID, because we've had so many people sick. At one day, we had 14 of our team off sick or isolating. One of our team has been left permanently disabled from COVID, and another of our team member actually sadly died from COVID. So we've been hit very badly by COVID, and most of the people who've been severely ill have been Black people and also Asian people. The white people have not been so badly hit by COVID. That's what we've discovered. So we have about 35,000 recorded patient visits. So that's a second visit, etc. We have seen about 18,000 staff, about 3,000 relatives. A lot of those are on the telephone this year because of people not being able to come in. You know, I don't know if it's been the same with you, but here people are not allowed to travel. Or have not been allowed to travel, and are not being allowed to enter into hospitals. You can only enter now one patient visitor per person is allowed, no more than that. Whereas normally you'd have big family groups coming in. We've given around approximately 1,000 communions in a year, about 200 blessings and baptisms and weddings and so on. I do most of the weddings here, and we do a lot of weddings. Quite unusually for hospitals, I suppose. I think because I like doing weddings, so we do a lot of weddings. And I can use the Archbishop of Canterbury's special license to marry people in the trust legally, which is very good. We do about 500 odd community visits. We do emergency call-outs and funerals, etc. Around 250 funerals. The funerals that we do, the death rate is much higher than that, but the funerals that we as chaplains do are where a person has no next of kin or no next of kin willing or able to pay for a funeral. So very often they're homeless people, or a lot of them are babies or children, a pre-24-week gestation. So in the United Kingdom, if a woman is pregnant and she miscarries or has a termination before the 24th week of pregnancy, then that fetus is not considered to be a human being in British law. They're considered to be waste product. And so we give funerals to all of those if the families want, and we do a lot more than this for those. Then the LFB at the bottom here is the London Fire Brigade. So we are also the chaplains for the London Fire Brigade, and these are our firefighter visits. So we don't deal with the public with the London Fire Brigade, we just deal with the firefighters themselves and give staff support to firefighters in London. So we've obviously, I don't know if you've heard of Grenfell, which was a massive fire in London a few years ago. We've been heavily involved in that. And that's the actual reason that I've been to New York, was because of the firefighters rather than for the hospital, but I managed to combine both. So these are the, this is last year. We've gone up since last year. We've gone up by about a third or 2/3, but these are some of our chaplains, different forms of chaplains. We do lots and lots of student work, and we train students here. We train chaplaincy students here. We have different levels of chaplaincy students, and I think this year we've got 45 students working with us, which is a lot of students. So it takes quite a lot of organisation to be able to help with those students. But these are the faith and beliefs of the patients we visited last year. It's averaged up, and you can see 40% chose not to tell us what their faith and belief were. That was their choice. We don't force anybody to say. 35% are Church of England, which is myself, 25% Catholic, 18% would be other Christian, so an Orthodox person would come into that. Muslim 10%, multi-faith and belief, which is Buddhism, Judaism, Hinduism, humanism, Sikhism, etc., are there. And then people who self-classify as non-religious are 6%. So that's the percentage that we did last year. And we have to produce these sorts of figures for our trust to show that we are catering for the diversity of our hospitals. One of the things with such a broad-based team, people coming from different cultures and from different faiths and beliefs, and note I use that term all the time, faiths and beliefs, because somebody who is an atheist or somebody who is a Buddhist, they are not people of faith or people of religion, they are people of belief. So therefore we use the term faith and belief. Is what can you do symbolically to help? So we have joined something which is part of Coventry Cathedral in the UK, which is called Together for Hope and the Community for the Cross of Nails. It's an organisation which trauma chaplains and trauma chapels and churches across the world have joined. The Christian one is Community for the Cross of Nails. And it's where people who have had deep trauma and who have had real experiences of trauma and still retain their faith, but understand that that trauma can be very debilitating to life. They tend to join and they want to do reconciliation work because of the trauma that they've experienced. So we have joined that organisation, and it's now part of a worldwide ministry. That's on the Christian side, but we've also joined the multi-faith one as well, the multi-faith and belief one, which is called Together for Hope. And it's something that we do. And this particular photograph here, you can see was when we actually joined those organisations, and we release doves. That's something that we do, which you can do with a Muslim. In that photograph, you've got a humanist, you've got several Muslims, you've got a couple of Jewish people, you've got humanists. I think there are some Jews standing there, Hindus rather, at the back there as well. And they're all able to release doves. That is something that we can do as a symbolic act together. We do a lot of this type of thing, although not so much with COVID. This is literally outside our hospital, and then you can see Big Ben and the tower. Our parliament is opposite us, and this is the river behind us. This is one of the weddings. This was a staff wedding that I did recently, or last year now. This is a doctor and a nurse. In the middle of COVID, we had lots and lots of people like this. They asked us to bless them, or they asked us to marry them, or they asked us to be with them because they thought they might die because of the work. And so many, we lost 22 staff members last year, and this year so far we've lost 14 staff members in the hospital. So it's been worse. It's been the worst time for staff death ever in the history of the hospital. And the hospital started in 1105. So it's been around. My job, first person to do my job as a hospitaller, as my actual job title, was 1105. It's been around a very, very long time. We believe we're the oldest extant hospital in the world. And we've had more staff deaths in 2020 than any year that we know about where records exist, including the Second World War. In the whole of the Second World War, we lost 19 staff members, and we've already lost more than that this year in 2020. So these two have both survived, despite the fact that they worked on the COVID wards, and they're lovely, absolutely lovely. Interestingly enough, she's from Northern Ireland, and he's from Sri Lanka, and they work in London, which is fairly typical for London. This is the Archbishop of Canterbury. His name is Justin Welby, and he is the head of the Anglican Church and the Episcopalian Church. His London office and London flat is in a place called Lambeth Palace, which is literally opposite St Thomas's Hospital, and it's less than 5 minutes walk away. And so during COVID, he came in and got himself trained as one of our chaplains. And I'm actually his manager. I want you to know that I am the Archbishop of Canterbury's manager, which is rather nice. And I had a message from him yesterday to say that he was literally with the Pope and wished me well, which was nice. So it's all right, quite good. He's not working with us at the moment, but he's going to come back again, he said. So each time there's been a wave, he comes and visits our patients and our staff. And delivers things like curries. He's very, very, very popular. He is a lovely man. And that was in one of my old offices. So we do a lot of staff support. We also do a lot of work, which is, for example, meditation work. Very popular as people are really struggling with COVID, struggling with journeying, struggling with illness. And this is something that we do, finger labyrinths. I'm sure you know labyrinths. And this is something that we do about helping people cope with that. I should be doing that with some staff in a couple of days online. You can do it online with them. You can do it face to face. So we do a lot of, I suppose, spiritual direction work, we would call it. This is a spiritual assessment tool that we use. It's an American tool, but we tend to use it when we are working with our patients. It's a very simple tool. We use several tools. This is one of the tools that we use, Hope. And this is the one we use when we're working with dying patients, and we would document this in their notes. So what was the sources of hope for the patient? What is their organised religion? What is their personal spirituality? And what effects that might have clinically. We use mnemonics. I realise that this wouldn't work with Russian, but in English it works. So Stephen will understand this. He no doubt uses it himself, sort of used worldwide in the English-speaking world. This is a tool that we have developed ourselves that we use with patients. And again, it's a mnemonic. It's called SEEN, i.e. we can see you. That's the mnemonic. And we start making sure the patient is safe and secure. Then we look at their relationships. We look at their understanding of spirituality, where they're at emotionally. Have they got a job? Is there anything that is difficult about their life or their money, and what the next steps are? And then we would document that. And that's in a bit more detail. And we use these emojis, just say, how are you now? And then you see somebody, and then you, after your visit, you say, how are you now? And you can mark that, because we have to show that our visits help the patients, and we have to show an output. And so this is a scientific way that we use output, so that we can show that the patient feels better after we visited them than before, that we haven't done any harm. And the very least we've done is do no harm, which is the ethical principle of doctors. So this is sort of ethical principles that we have to use. This is another tool that we use, which is called I Am Secure. We nicked this again from America. The previous one we invented ourselves. This is one we nicked from American veterans hospitals. And we would fill this in with a patient with PTSD, and particularly during COVID-19, because a lot of our patients have had post-traumatic stress during COVID-19. Whether it's because of the number of death, or because they're frightened of coming into hospital, or they feel isolated, or they might have lost their job, whatever it is. So we fill in these things, and it's to do with the impact of COVID-19. What is their meaning of life? What is their spirituality? What gives them peace and ease? What is it that they have? Do they have a community? Do they have anyone supporting them? Do they understand what's happening to them? Are there any rituals or practices or ceremonies that we need to know about to help them in hospital? Endings, there's been a lot of COVID deaths. What impact has that had on your faith and belief? And have they thought about their own mortality? And then we would fill this in, and we would give a copy to the patient, so that they have some security of remembering where they're at. This is the greater one, and name, the chaplain, the date. This is because we have to keep records of these. So a lot of what we've been doing is people have been in a really hard place. They've concreted themselves over. Every now and again the cracks come, and there's something joyous that we try to help them remember the joy and the reason for life and the reason for wanting to live. This is our course that we do, one of our courses. We do a postgraduate certificate in healthcare chaplaincy and in spiritual care and health, depending on which one people want to do, and that's linked with our professional body. These are some of our students. This year we have, I think it's 27 students this year doing the course, which is excellent on this particular course. from all different faith and belief communities, and they're trained together. And this is after you've started in chaplaincy, you've done some training, you've done your training chaplaincy work, and then you do your postgraduate certificate. It's a year's course, and you have to have 200 hours of supervised practice together with 3 academic modules and 1 module actually working in the hospital. Then we do an access to chaplaincy course because we concentrate on communities that don't normally have faith and belief people in hospital, so that's new for them. And we do an access to chaplaincy course before the postgraduate certificate. And it enables them to have the another 200 hours. It enables them to do to be able to apply for chaplaincy jobs. These are some of the course objectives here, and these are what they actually do. So they do trauma and disaster, for example, the 4 principles of communication and advanced communication skills, spiritual care screening and spiritual care assessment, the tools, the various role plays that we do. We do a lot of work with role play and simulation. Reflective practice, what does that mean? The 4 models of reflective practice, how to write up a case study, how to write up a learning journal, and they do the pastoral placement, and they do ongoing reflective practice. Okay, I don't know if anybody's got any questions, but I think I've probably run out of time. Sure.
Thanks a lot, dear Ms. Hilburn, for your most wonderful presentation. We heard so many interesting and so many examples. It was very, very interesting. I'm really glad to meet you. 20 years ago, I was in St. Thomas Hospital, and we also had nurses coming from the hospital to teach our nurses to care of patients, to our Sisters of Charity. But regretfully, dear friends, we're out of time, we're out of schedule. That's extremely interesting. I would listen to you all, you know, for hours, but I'm afraid that not everybody can spend that much time for that. So we would like to ask our press secretary, Vasily. He really asks us to take for your talk for no more than 10-15 minutes. Being concise is equal to being most talented, as we say in Russian. We'll try to stay in time. I'm very glad that there are so most interesting talks here. Most interesting topics are discussed. But now, dear friends, let's come back to our agenda. And now, next one is a talk of the director of the Chameleon Research Center, of the priest Daniel Mozzi from Italy. So, Father Daniel, we will be very glad to listen to your most wonderful talk. Thank you, and the floor is yours.
Grazie, vi ringrazio tutti, saluto tutti, saluto in modo particolare Monsignor Panteleimon per avermi invitato a questa conferenza che è dedicata all'esperienza della cappellania ospedaliera in Italia. In modo particolare occorre cercare di analizzare le caratteristiche del programma educativo per i cappellani e vedere le competenze professionali richieste. Io ho lavorato per 10 anni nell'ospedale generale di Verona e adesso sono a capo del centro camiliano di formazione sempre a Verona. L'invito del Signore Gesù, curate i malati e dite loro è vicino a voi il Regno di Dio, si interseca con la sua personale identificazione con l'infermo e l'ammalato che mi avete visitato. E anche con chi se ne prende cura, come fa Dio stesso che risana e guaria affranti e fascia le loro ferite, incarnando il modello del buon samaritano. La Chiesa nei secoli ha fortemente avvertito il servizio dei malati e sofferenti come parte integrante della sua missione e attenta al mondo della salute, affina la propria capacità di compassione, aiutando a trovare le strade per una presenza che cura, conforta e consola.
Church has always been showing compassion
In
and also
Italia
the presence of
la dimensione
being comforting
spirituale
a human being.
viene
In Italy,
riconosciuta dalla
the spiritual dimension
Costituzione
is
della
recognized by the
Repubblica.
Constitution of
Tra
the
i
country.
diritti della
It is
persona,
recognized as one of the basic
nella
civil rights
completezza
of a
dei suoi
human being.
valori e dei suoi bisogni, non solo materiali ma anche
The
spirituali.
right which in fact
La
evaluates
revisione dei
his
patti
values,
lateranensi
and among
del
his values and necessities and meaning
1984
are not only
ha
financial,
assicurato che la
spiritual.
degenza in
I
ospedali,
can say
casi
that,
di cura o di assistenza
state
pubbliche non possa dar luogo
is in
ad
charge
alcun
of health
impedimento
and well-being,
nell'esercizio della
but
libertà religiosa
chaplain being in
e
hospital
nell'adempimento delle pratiche di
should not
culto
be
dei cattolici. L'assistenza
should not be
spirituale ai
barrier
medesimi
to
è
any
assicurata
other
da
a barrier
ecclesiastici
to
nominati dalle autorità
Catholic
italiane
rites.
competenti.
So spiritual guidance is done in a hospital who are
Per le altre
approved by the
religioni,
Italian
i loro
authorities.
rapporti con lo
So they're not
Stato
barriers to one
sono
another.
regolati
When it
per
comes to
legge
other religions, it
sulla
is
base
very
di
important to
intese con
say
le
that they
relative
have certain
rappresentanze.
interrelation with the state.
Attualmente
They have their
i
own
malati di
relationship
altre
with the state,
religioni
and this is
possono
related to this
richiedere
type
alle
of
caposala
dialogue
la chiamata di un proprio
between two.
ministro di culto.
So if the patient belongs to some other confession, he can ask a chief nurse to summon
Un possibile scenario per il futuro sarà proprio quello di costituire anche in Italia cappellanie ecumeniche o interreligiose, come già avviene all'estero, a motivo della presenza di ammalati di altre chiese cristiane o di altre religioni. Alcune strutture ospedaliere sono fornite, oltre che di una cappella per i cristiani, anche di un'apposita stanza del silenzio, dove i malati di altre religioni o i loro parenti e amici possono pregare. Nei grandi ospedali sono presenti le cappellanie come organismi pastorali della comunità cristiana negli ambienti della sofferenza umana a favore di malati, familiari, operatori sanitari. Nel passato le cappellanie erano formate prevalentemente da sacerdoti dello stesso gruppo di appartenenza, o diocesani o religiosi. Da qualche decennio sono state avviate alcune cappellanie miste aperte a membri provenienti dal clero diocesano, religiosi, suore, diaconi permanenti, laiche e laici. Queste cappellanie hanno favorito la condivisione dei vari carismi e una ricchezza dialogica, segno di una ecclesiologia di comunione, secondo il proprio grado di corresponsabilità, in vista del superamento dell'autoreferenzialità di ogni gruppo, promuovendo un volto di Chiesa capace di rispondere alle emergenze del tempo con le potenzialità di cui dispone. Le cappellanie miste sono state pensate e volute in maniera lungimirante, affrontando i disagi e le fatiche della loro accettazione da parte della gente, perché prevale ancora una concezione piuttosto clericale di questo ministero. Non occorre trascurare le difficoltà che presentano le varie aggregazioni dal punto di vista della capacità di collaborare, di confrontarsi, evitando gli scontri e di accettare nuovi stili di vita, diverse vedute e comportamenti. Camminare insieme. Forse è anche per questo motivo che le cappellanie miste stentano a venire costituite. Una difficoltà abbastanza diffusa è data dal problema di assumere religiose, laiche e laici come assistenti spirituali. ben visti a titolo di volontariato, ma non
lay
ancora
persons, both
come
men and women,
stipendiati all'interno delle strutture
because
ospedaliere.
these people
La revisione dei patti lateranensi
very
esplicita la
frequently,
scelta di personale ecclesiastico.
and we also need to
C'è
revise
da
the,
riscontrare un'ulteriore difficoltà nel superamento
we
di una
also have another
pastorale
difficulty
quasi esclusivamente
in
sacramentaria,
overcoming
a favore di una pastorale integrale della
almost
persona,
sacramental
preparando operatori pastorali
service,
competenti ad affrontare colloqui di
the,
relazione e di aiuto.
preparation of well-qualified priests and chaplains. First of
In
all, they must be
Italia la
competent
situazione
in
non è
interviewing, providing
uniforme.
service and
In Trentino Alto Adige,
spiritual
dove
guidance.
mancano sacerdoti
In Italy, it is not
diocesani,
homogeneous.
religiosi e
Like,
religiose, l'assistenza
Trentino Alto, for
ospedaliera
example,
viene assunta
need,
quasi interamente da laici, ai quali le strutture sanitarie richiedono espressamente una formazione specifica a livello teologico e umanistico-relazionale.
Particular type of training in theology and human interrelationship.
Costoro quindi possono accompagnare i malati nelle varie fasi della loro vita, compresa la terminalità e la celebrazione dei riti di commiato.
And different rituals related to this.
Di fronte a questa situazione, quale tipo di formazione si richiede in Italia per ogni membro di una cappellania ospedaliera? Purtroppo non è prevista alcuna formazione obbligatoria. Ci auguriamo che chi viene chiamato ad assumere un ministero per i malati possa comprendere l'importanza di prepararsi adeguatamente e chi sia deputato a scegliere gli operatori pastorali lo faccia avendo in mente un buon impianto formativo. Innanzitutto, la scelta di inserimento in una cappellania ospedaliera deve prevedere un cammino di conoscenza della persona per stabilire il grado motivazionale, la capacità di lavorare in un gruppo, le risorse personali, le reali aspettative, favorire la crescita della vita di fede in contesti di dolore diffuso. In questo senso, è buona prassi che i seminari diocesani includano il servizio in ospedale tra le varie esperienze formative dei seminaristi. Se un tempo le suore lavoravano negli ospedali come infermiere, oggi la loro presenza, notevolmente ridotta, viene richiesta per la pastorale. E anche le congregazioni religiose femminili possono prevedere la formazione in pastorale della salute nelle case private, nelle parrocchie e negli ospedali.
Especially when they come to help in hospitals and in hospitals or hospices for those who suffer from.
Una buona formazione teologica costituisce il requisito fondamentale.
Also, I must mention
con il conseguimento del baccalaureato in teologia o una laurea in scienze religiose, una licenza di specializzazione in teologia pastorale, spirituale, morale e bioetica, specialmente per i membri che debbono essere inseriti nei comitati etici. Sarebbe davvero pertinente una formazione in ecumenismo, proprio perché la Chiesa si riscopre comunità sanante per una cura integrale di tutta la persona.
Usually cares integrally about a human being. It has integral approach to a man.
Secondo un modello bio-psico-socio-spirituale che risulta un terreno comune tra tutte le religioni.
Spiritual model, and this is the model which is absolutely common for all the confessions.
Purtroppo è stato chiuso il Camillianum con rammarico di molti, compreso il sottoscritto, un percorso accademico più semplice in teologia pastorale della cura e della salute è attivato a Roma alla Pontificia Università Lateranense. Master di bioetica vengono offerti a Torino, a Roma e a Palermo. La laurea in bioetica è accessibile all'Università Cattolica del Sacro Cuore. Le università statali affrontano una bioetica laica. Su un versante non accademico, il nostro centro di formazione di Verona offre un biennio di pastorale della salute, promuovendo un programma che spazia dal dato biblico, patristico, dalla riflessione teologica, pastorale e spirituale. Ma basterà la sola formazione teologica? No. Agli inizi del XX secolo, Anton Boysen, pastore presbiteriano, si rese conto che la sua malattia poteva essere vissuta come un'esperienza di crescita e iniziò a studiare il suo caso e un buon numero di altri pazienti ricoverati. Comprese che le sole competenze teologiche non erano sufficienti per affrontare qualsiasi situazione pastorale che potesse presentarsi nel corso del suo ministero. Divenne cappellano e si fece promotore lui stesso della formazione dei cappellani ospedalieri, radunandoli e condividendo ciò che stavano vivendo, studiando i documenti viventi dei malati, con la modalità learning by doing. Oggi l'educazione pastorale clinica si struttura come un processo di formazione teologica e professionale in vista del ministero pastorale, in cui studenti di teologia, sacerdoti, religiosi e laici assistono persone in crisi, vulnerabili, sofferenti, attraverso un tirocinio nelle corsie ospedaliere, la supervisione clinica e lo studio che si aggancia alla pastorale pratica. Formazione in counseling pastorale. Il counseling in Italia è riconosciuto come una relazione di aiuto. È un processo relazionale tra un operatore preparato e uno o più individui in difficoltà e si ispira alla visione cristiana della vita e della persona. È considerata una vera e propria diaconia ecclesiale, un ministero specifico della comunità cristiana per l'accompagnamento di persone, famiglie, gruppi che chiedono un sostegno per affrontare momenti di criticità esistenziale. Praticando questo servizio, il counselor pastorale utilizza le qualità personali, conoscenze specifiche della spiritualità, della teologia e delle scienze umane. Ciò consente all'individuo incontrato, all'interno del progetto che il Signore ha su di lui, di dare un senso alle fatiche del suo vivere, in una profonda armonia tra la costruzione del proprio benessere psicologico e le esigenze etiche e spirituali. Formazione umana e spirituale. Per tutti coloro che non possono frequentare corsi di educazione pastorale clinica o di counseling pastorale, è possibile partecipare a brevi sessioni di dialogo e relazione di aiuto, per sperimentare in piccoli gruppi la possibilità di migliorare la propria competenza relazionale, ponendo maggiore attenzione alla propria altrui modalità di comunicare emozioni, sentimenti, pensieri, mediante il linguaggio verbale e non verbale, imparando a riformulare in modo empatico quello che il malato esprime, evitando di dare consigli e di rispondere con frasi consolatorie o investigative.
And we need to speak to a person in a
Per
delicate
imparare a
manner
lavorare in un
without
gruppo
asking
sono
brutal
molto utili
questions.
appositi percorsi di
So,
training
not to ask
che aiutano a
any
conoscersi
questions
meglio e migliorare le proprie
where they are
potenzialità,
not needed.
riconoscendo le
And
figure di
special
leader,
trainings are definitely required.
superando le difficoltà
Very
relazionali,
important to
imparando a
get
formulare e ricevere
leaders,
feedback.
spiritual leaders, and
E a
also to
motivo
overcome
della maggior presenza in
challenges
ospedale
in
di
relationship
persone provenienti da varie parti del
communication.
mondo, non sarebbe da dimenticare una buona conoscenza delle lingue straniere
Hospitals, we often see people
o il
from
linguaggio
the
dei segni
different parts of the world. It's
rivolutenti
important to know
per
foreign
riuscire a
languages.
entrare in
We
dialogo
should
anche con
know
questi malati.
the
Altri
various
corsi
languages,
riguardano l'accompagnamento di un malato
gesture
nella
language.
fase terminale o l'accompagnamento nel tempo del
So to avoid
questi
the
accompagnamenti singoli
use
o
of
tramite
interpreters.
gruppi di automutuo aiuto.
Also, so to know the sign language, to know other languages, and also it's very
Io vi
important
ringrazio
with the patients.
per
Next, of
questa
course, is the time of dying.
possibilità. Se avete delle domande, sono a vostra disposizione.
Groups. So on one side, I would like to thank you for your participation, that you listened to my presentation, and if you have any questions, I will be very glad to answer them. Thanks a lot, dear Father Daniel, for your most interesting description of various educational practices and form of education, because it's not just enough to have a wide heart and a wide and open heart, but also it's very important to have a very wide, so to say, range of visibility, because different people, they have different range of vision, different contexts, and we need to compare our training and educational programs to find something new in our curriculum and to find something in common. And thanks a lot for your most wonderful talk. Now we're switching to the next topic, to the center of Europe, to Germany, Heidelberg, and we have a talk by Annette Hausmann. We're very glad to have here representatives of Heidelberg from Germany, and we do feel us with you. So I saw all those terrible pictures of flood. I was impressed with all those terrible pictures, and now we expect to have the most interesting talk from yours. So the floor is yours. Thanks a lot for welcoming word, for the possibility to take part in your conference. I'm very glad to have this opportunity to talk about our experience, which we gathered during the pandemic of COVID-19. Thanks a lot for your words of compassion regarding the flood in Germany. I will give my talk in German for translation, and my slides will be in English to make them easier to understand for majority of the audience. I hope you can hear me and you can see my slides. So now I'll try to present some results of our work. During the COVID-19 pandemic, the healthcare system was challenged with unprecedented tasks and objectives, and naturally it was related to issues with budgeting, with funding, and with the need to support the chaplain activity, and with psychological support provided by chaplains. Many tasks actually emerged during the pandemic due to the limited social contacts. And our capacities and capabilities for chaplain ministry were considerably constrained. Communication was constrained due to the use of masks, which we all have to wear. And many of us already mentioned digital tools open due to the new or appeared due to the new technologies. And once a personal meeting was not possible, we had to use those electronic means. What I would like to stress, and what plays a central role in our studies, is that the medical professionals also suffered of all those challenges of the pandemic. of that huge burden, and we had to help them to handle it properly. And I'd like to show you what we do with regard to collaboration between theory and practice. I'm a professor of theological faculty in Heidelberg, for Faculty of Protestant Theology, and I'm actively, we are actively involved in the issues of chaplaincy in hospitals in Baden. It is southwest of Germany, and we try to find creative solutions and in order to handle those challenges, those burden on the medical professionals, which we've heard from many talks. And I would like to thank you all for presenting experience from various countries, how they what they did, how they worked during the pandemic. We try to discuss the results of our studies within the focus groups and within testing or implementation of the study results in practice. And as previous speakers mentioned, it is extremely important for us to introduce theoretical solutions into practical dimension, how to use digital tools, how to organize training program to prepare for that. So what we did, quite early after the end of the first lockdown in Germany, we did the first study with chaplains all over Germany, and we tried to ask them, to answer our questionnaire. We got 300 responses. Of course, it's not representative enough, but even based on that, we can make some conclusions on the pandemic role and effects. We saw how chaplains worked during the pandemic and how they fulfill their tasks in various realms, because we talk here not only about hospitals, but also concerning schools, church communities, and in long-term care facilities. And we tried to discuss those topics, which actually which are covered or asked by patients requesting priest assistance. And we tried to discuss in details the chaplaincy in hospitals, and we asked those questions to hospital chaplains. And we tried to sum up the experience, in particular positive experience, what do we need for successful activity chaplains in hospitals, and what could be improved and perfected, so to say, to provide high quality spiritual support to patients in hospitals. This winter 2020-2021, we launched another qualitative study, which actually repeated a lot the spring study. We wanted to ask questions on the new experience which appeared and which new conclusions could be made after the second lockdown in Germany and out of those social restrictions which were imposed. And I would like to introduce some results of the study. I hope that would be quite interesting for representatives of other countries. It is a view into Germany from the point of view of that burden and that tasks the chaplains are challenged with. And those social restrictions resulted in the following. Number of contacts was quite low in a personal sense. It was related to schools and communities as well as hospitals. So this meeting, face-to-face meeting during the first lockdown, was turned to be almost impossible. And these visits, these meetings decreased almost more than 30%. Besides, we started to use other means of communications like phones, email, digital communication, and also we use traditional communication means like paper letters, and this grows. We saw it we noticed during the second survey, we saw the increased amount of digital communication, and along with that, we saw that personal meetings, personal visits during the second survey, as the second survey shows, number of personal visits still actually increased if some conditions for protection were met. So already it was mentioned a lot that the contact with the hospital, with hospital management is very important for successful chaplaincy. And we can just confirm it. We see great differences when communication is decreased, when we talk about the personal communication, and along with that, in schools, we see less of personal communication in schools, in diocese, in nursing homes. But looking at the hospitals, we can see that chaplains in hospitals, which work on a permanent basis there, they tried to maintain the amount of communication with patients because they were well known as those hospitals. They had personal contacts with hospital staff and management, and they had much more of opportunities to contact both patients and staff members. So they consider their work in the hospital as a part of their duties in the community. That is very important, crucial factor, the contact with the hospital. And a couple of words about the topics which actually important for people turning to priests in hospitals, and quite frequently. And I think the most frequent three topics is just the need to talk to someone, just to overcome the isolation or loneliness. And it was a search for hope and solace. And we can compare it with the first study. So those topics at the second study were represented even to a larger amount versus the first one, versus the second one. And I can mention two points here. First of all, recognizing those problems that developed during the pandemic. And second thing, it is those issues German people who during the second lockdown were underwent much stronger pressure. It was much harder for them to overcome it compared to the springtime. And what else we can see? It's a definition of the chaplain activity. The main purpose of that is to create, to contact people, contact patients, and talk to them. Maybe not talking about the diagnosis, the disease, the stage of the disease. And successful examples are actually related to the following, that this chaplaincy ministry provides support to people, not in the dimension which is not directly related to the hospital. So how chaplains work, what is the problems they have? Dr. Hausman, I'm sorry for that. Could you please switch the slides of your presentation, because we can see only the first slide of your presentation. I'm sorry for that interruption. We don't see you switching the slides. Oh, I'm terribly sorry. I didn't see that. Now you can see it. If you open to a full screen, it would be great. We can see the slides, but please open the full screen mode. You should. You were to interrupt me. I wrote it in the chat. I'm sorry, excuse me for that. I wrote it in the chat, but I'm sorry for that. Now you can see my slides. It's not full screen mode, but we can see the slides. So excuse me for that. I will send you my presentation so you can read slides later on. So now let's see what are the issues the chaplains are challenged with. First of all, it's a loss of structures people are used to, in which was, so to say, the foundation of their daily work. So we had, or they had to rebuild their whole activity. We see differences between fields of pastoral care, hospital chaplaincy in particular. They managed to keep their routine schedule versus their colleagues working in schools or nursing homes. The people in schools and in nursing homes suffered much more because the activity all of a sudden changed drastically, and hospital chaplains noticed that they are regarded as it was much more of a, so to say, deference. And I should say it's very important to conduct various trainings and educational events, especially for those who are in stress. And the stress is related quite often to the lack of skills and knowledge. And so those chaplains require some professional support. Quite often they need to have spiritual guidance and support. And then several words about those positive items, except for, besides those burden and workload, and many ideas and opportunities which were mentioned in our study, starting from digital communication. Digital communication was widened a lot. Many teams started to coordinate the activity via messengers, and besides, simultaneously, they widely used digital platforms, and in particular, in the modern church, they create a platform which makes possible to all chaplains to stay in permanent communication. With the help of that platform, they were able to maintain and support spiritual, so to say, stability of patients. Also, with the help of this platform, chaplains were able to work with the teams in hospitals and clinics. So they managed to work much more intensely with the staff, with doctors, with those who care of patients, with medical doctors, with nurses. They discussed a lot ethical questions. So chat and video chats, it has been also discussed. So also remote services like teleservices, we also mentioned them. If the physical access was not possible, people might communicate via electronic or digital means. Besides, dear friends, I'm sorry for that. They asked me to keep silent, but I feel the slides are not changing again. It is again the same slide we see. The slides are not switched. I'm sorry for that. I'll try to launch my presentation once again. Yes, I see that the slides are not switched. Which slide you can see? It's slide number 8. Yes, because I'm already at the 10th slide. I'm sorry for that. I'll relaunch the screen share mode. I hope you can see it better. So I'll send you the slides later. So several words about the factors of success, which were fundamentally important for chaplaincy during the pandemic. Well, we could see that on one hand, it's very important to have a professional interaction within the team. Even chaplain has a good communication with doctors, with the medical professionals. If they can coordinate closely, the activity produces very good effect. Besides, inter-religious communication and cooperation plays a very important role, and is one of the factors of success. Also, keeping contacts, maintaining contacts is also a very important factor for success. Also, one more thing I would like to say, we need a support. What I mean by that, I mean a support of superiors, church superiors, support from colleagues, and support from the church congregations. For instance, when the chaplains are, so to say, unloaded, so to say, from the point of view of the main job, I mean, like services providing, so to say, worshiping or religious services, for instance. So, and I should say that in Germany, we're quite slow with digitalization. So each patient can contact a chaplain through iPad and use an iPad in general. During the last months, recently the situation improved a bit, but again, technical capacities for communication, technical means for communication are really important. And organizational support is also another very important issue. And also working with public relations, PR service, and support on ethical issues. I'm switching to the next slide. Can you see my next slide, 11th? Not yet, not yet. We still cannot see it. Oh my goodness. Oh, that's terrible. That's terrible. I need to turn it again. It's still tense. It's still slide 10. I don't know. Yes, you know, I'll send you my presentation. Basically, it was my last slide to show. And I wanted to talk about the options to support hospital chaplains to improve their working conditions, to unload them from the point of view of administrative work, to so to say, to give them kind of the upper hand and professional mentorship, chaplain for chaplain. It is a very important issue. So with that regard, we should talk about the interreligion support and interaction and support from a professional. So with the chaplaincy system, we develop various courses and trainings working in digital format. And also we can provide training for volunteers, and we pay a lot of attention to that. We see less of volunteers because of the pandemic, but we would like to resume that activity. I should say that chaplain service, chaplain ministry in hospitals should be transformed. It needs to have some foundation from the technical organizational point of view. And currently, we need to set up a study how to make this service, so to say, resisting the external effects. I will end up everything. You can see everything of what I said in at our website. I will send you my presentation. Thank you for your attention, and I expect your further talks. Dear Professor Hausman, we're really thankful for your talk. We hope to see your slides, and it will be quite interesting for us. Thank you for your participation and for your most interesting story. Presentation. Now we have presenters from Russia. I should say that I love you all. I know you for many years, but please do not feel insulted. But I would like to decrease your presentations in time, because we're really out of schedule, we're out of time. Also, there are some questions were asked in YouTube, and we would like to listen to the answers from our foreign colleagues, from our friends, concerning the experience of combating COVID, of responding to COVID in various countries like United States and others, UK. So now, hope you can see. It seems like we need to have another conference. It should be several-day conference to fit everybody and to continue with our interaction. So it seems like we don't have enough time for our discussion. And our dear friends, if you decide from the Europe or the States, if you decide to organize similar conference of that kind, we will be really pleased to participate. So maybe we can expect some proper response from your side on that conference, so to say. So now I would like to give a floor to a wonderful person, Svetlana Braun. I'm really thankful to her because she she actually organizes our interaction with the healthcare department of Moscow. Moscow is a very large city. We have lots of hospitals, and due to the works of Svetlana, we have some good practice of interaction, which should be, so to say, strengthened in a regulatory way. So the floor is yours. Thanks a lot, Your Grace. And I would like to start with the words of thanks for organization of that nice, great conference with participation of the government of Moscow, government of the Russian Federation, and Russian Orthodox Church. And of course, it's a great time to find best practices from all over the world. I write down everything. I write down wonderful examples and practices. Half my notebook is full already. So if we have your presentations, it will be also very useful for all of us. And naturally, the words of thanks. And once again, with congratulations for you, Bishop Vareya, as the head of Synodal Department. I'd like to congratulate you with your 30-year anniversary of hospital ministry. And due to your work activity, due to you, I found out about that institution of hospital ministry. And it seems like this practice started from the first municipal hospital where we worked as a priest for 30 years. And one of the best practices is the assistance to terminally ill patients and Sisters of Charity. So Department of Healthcare Moscow and Russian Orthodox Church have a huge experience of effective interaction in providing social services, social ministry to our people. The tasks of the Healthcare Department are very close to the task of the Church. So we treat physical problems, and Church treats spiritual issues. Our tasks are complementary. So informational, educational support of population and promotion of healthy lifestyle in the society. Here, your assistance to dependent patients, meaning patients with alcohol abuse or drug abuse, it is invaluable. Of course, we should also strengthen reproductive health. Your activity in the field of abortion prevention is very important. Protection for family and childhood. Protection of health, and your attitude to vaccination is the only way to protect yourself and people around you. You also play a very important role here, and you work quite actively in this field. And actually, in all the hospitals of the Healthcare Department of Moscow, we have chapels and temples and prayer rooms where religious rituals could be provided. As I said, the best practice is the experience of the Sisters of Charity in the first city hospital, and also Melita Vojnovic said that chaplaincy was in a greatly required when HIV virus was discovered, and the best practice of sistership of hospital ministry was seen in the infectious hospital number 2, when we have our AIDS center. And it's a huge assistance to AIDS patients where their relatives are not there anymore, and sisters and hospital chaplains, as we can call them, that is not practice in active phase, so to say, terminologically. So they provide huge assistance to such patients and their relatives. And naturally, assistance in hospices plays a great role. But coming back to the pandemic, our main topic today, and these tragic events, they unite people always, and we see such a great request for spiritual support from the society as a whole, because especially at the beginning of the pandemic, there was an informational vacuum. It was not clear where to find, so to say, trustworthy information. People were felt great tension, and spiritual care, spiritual aid was invaluable and in great need. From the beginnings of pandemic in Moscow, both medical professionals and priests worked together, and as our as His Grace Panteleimon said, that the role of priests is very important in providing care for patients, but how care was set up and organized in Moscow. Of course, it was due to the participation, direct involvement of your Grace Panteleimon, and Melita Vojnovic showed that slide where you visited hospitals in the Kommunarka region, in hospital number 52, and your team organized everything in a good systemic way, in a 24-hour mode, and we organized with you all the works to set up access for priests to the red zone, where everything was restricted and closed when all visits were restricted because of the lockdown. Well, the group of voluntary priests was prepared, acting upon the blessing of the blessing of the Patriarch Kirill. How it was organized, maybe it would be not quite clear for our foreign colleagues, but we followed our colleagues, volunteer colleagues, medics, as students of the senior courses, who organized assistance in red zone on treating and caring patients. And remembering about that experience, well-known, good experience, we organized a possibility for volunteer priests to enter this red zone as within the group of medical volunteers. So volunteer priests turned to be the medical volunteers, so to say. But they underwent proper training, of course. And of course, we had a special chat. And of course, because of that situation, we organized a digital communication, which make possible to set up this work in a 24-hour mode to find the needs for the priests. Is a 24-hour clock hotline was organized, and all the information was properly and timely passed. With every hospital where something was requested, there were responsible persons assigned by the hospital management, and we organized this access for priests. I would like to thank the words of thanks to all those volunteering priests who traveled from the one side of Moscow, the huge city. They travel from one side to another, and they so to say worked their hearts out, and quite frequently patients even had no idea who called up a priest. he or she didn't ask for them, they were non-believers. And we had patients who said, oh no, I never called the priest, and had physicians. So no, patients didn't call, but relatives called to that hotline because communication was interrupted because of the pandemic. There was another case to the hospital of veterans. We have 4 such hospitals, and red zones were open in some of them. The relatives called for priests to visit the veterans, Second World War veterans, and other patients who stayed there. They literally dragged them. They asked for confession and so to say, and anointment. So we know that it's once again, as we can say in Russia, as we found when we found this period of time about that period. So as we can, spiritual support was provided not only to patients but also to family members, and professional burnout during that period of intense work. It was also necessary for medics as well. And this assistance, everybody, let's say, required it. And due to your guidance, your grace, it was actually properly provided. And on a regular basis, the whole group of volunteers, we provided PCR from the and medical organizations helped us to find. We organized everything properly, and we can see how we, just through the good communication, can organize everything. And I like this definition of WHO, saying that health is not only absence of physical defects. And many foreign colleagues mentioned that naturally we talk about integrity of our body, or that our body is kind of some holistic entity, and it's integrity of body and mind and spirit, and we should talk about that. This work was properly organized, and with Synodal Department we have an agreement. As our foreign colleagues mentioned, we had this protocol or memorandum on interaction, and many of us said that so to say, the key to success, the recipe for success, is the effective interaction with hospital management, with hospital administration. We came to conclusions we need to organize a kind of a task force, a working group, and share our opinions and solutions how to improve this interaction. And this task force in the Synodal Department, it includes also all Russian public organization, medical volunteers. It's Moscow regional unit. It's our leading hospitals, hospital number 52, Kommunarka Hospital, where you guys were, and it's in psychiatric or mental care hospital, and palliative care and hospice care and pediatric hospitals, because we also have palliative care units there. So such working groups, such target force, not accidental, so to say, gazetted the February 11th, it's a global patient day, where the face into the treatment and into the and belief into the cure, it actually united us. And I would like to thank you, Your Grace, for such a synchronous, systemic, methodical, and cohesive work for and current and selfless work, and all the participants. And we can see that this training of volunteers, we saw so different. We see those different people, so diversity of people coming to your trainings, and it's a great contribution into our COVID response and care of our patients. And I would like to thank you for that. Due to such, so to say, experience, and due to the experience you described, the hospital ministry will stay in Moscow, will be in Moscow, and it's a huge, tremendous assistance to our patients. Thanks a lot for your participation. Thank you a lot for wonderful presentations. Thank you for your attention, and wish you all good health. Thanks a lot, Svetlana. Please send our words of thanks to Alexander Sherepin. He's doing a lot to us with this work. Of course, was organized with under his guidance and auspices. Hopefully, thanks God, we, so to say, avoided those cataclysms in our country with God's help. And thanks a lot for your prizes, so to say. You award our doctors. Now I would like to call to ask Mariana Lysenko, the head physician of Hospital 52, and I would like to say that I do love you. And I do not always have this opportunity, but through internet we can do it clearly. We're just thankful for everything you do for us, for the city, for the patients, and I do specifically thank you for your attitude to volunteers. Not all head physicians understand it, but you provided very good examples. Like you provided good feeding for the volunteers in the ICU. So attitude for volunteers and to priests is very important. How they work there, how you see with them. So you are kind of the leading person, leading hospital in that respect. So you can talk as long as you need. I cannot limit you at all.
So. I would also like to thank you for the fact that everything changed in our lives. The pandemic, of course, changed our perception of the world of spirit and something spiritual. And there are not only negative lessons that we have learned from it. I think that the pandemic has been given us, just like any other challenge, to understand many things. For example, to understand the role of priests who come to the hospitals. Of course, those people who are terminally or very severely ill, they have always been related to particular rituals and some traditional things disregarding their confession and belief. And it has become a tradition to associate this with a sort of end of life and transition to another world. Those people who treat patients, physicians, they do not always understand such things because we try to save the life, but the pandemic changed everything. We suddenly understood how important it is for everybody, for patients and for the doctors, because there are no person who are not believers. Everybody believes in God. In the situation of crisis, we always address some superior powers. Maybe we do not particularly describe it, but any person tends to address to a superior power when he is afraid. And in the period of pandemic, in fact, we all were afraid, not only those who got COVID-19, but those who contacted with them and who needed actually to start working with a completely unknown infection, a completely unknown virus, with unknown protocols of treatment and huge responsibility for a great number of patients who started arriving to hospitals with a completely unknown, unclear diagnosis. And we needed to seriously deal with protocols, revise the protocols and understand what should be done and how should be done in the domestic medicine. Of course, that was a great deal of uncertainty, great deal of fear for our own lives, for our parents. This is just human fear, you understand what I mean. And this infection, hospitals, they were closed for visitors. So we became isolated from the community, both doctors and patients. We didn't understand the prospects. Young patients started to die without any comorbidities, major comorbidities. There was huge workload for absolutely all hospital staff. All of us worked 24 hours, 7 days a week. And of course, we came to certain conclusions. And this is part of our professional skills. As a matter of fact, we understood that the system of healthcare here in Moscow is ready to handle any challenges. But at the same time, there are certain psychological, spiritual issues which are left unclear. And I'm speaking about patients, and I'm speaking about those who treated them, paramedics, and everybody who lived in this city, because the hospitals in Moscow can can actually be described as a small town or even a city. They are huge. So we started inviting people to join us. And this is quite a normal outcome from this situation. We needed to become more open than we previously were. Medicine is quite a closed community, but this culture of trust started developing. And we even developed such a slogan as trust builds trust. We understood that it was really so. And that particular openness allowed us to receive feedback and much better quality of service if compared to the previous. And indeed, in that very difficult period, we sort of revised our values and updated them significantly. We understood that your spirit, your soul, and your health is utterly important, much more important than any financial benefits. And I suppose this is very severe, but still this is correct lesson that we learned from the pandemic. And what Svetlana Nikolaevna mentions, what WHO uses as one of the definitions, that health is not only physical health, somatic health, but it requires also spiritual part, mental part, and this is something that we now understand. And I suppose we have been just pioneers in many aspects, and nowadays we need this priesthood, this chaplaincy in the hospitals, because this is a bridge between people to communication of the outer world, as well as the servicing for the health providers as well, because they are actually overloaded as well. And the health providers cannot communicate with the patient and provide patients with a great deal of human just consultation, of human participation. Of course, because they don't, it doesn't happen because they don't want it. It just happens because, unfortunately, they don't have time for this. So I would like to say that we got a huge support from the church, and your Christmas present, in fact, is something that we still remember greatly, because children sang for us, and we felt immediately that Christmas was coming, that happiness was there, despite the fact that not much changed. We just spent some time together. We also worked quite actively with Ivan Kudryavtsev, who is the master of one of the cathedrals, and generally speaking, we also had an exchange of ideas and opinions, and quite the priests who were working in the red zone, they had a number of different responsibilities in relation to the status of infection, and of course they needed to comply with all the rules of safety and security, which again is not customary for a priest. And the time was restricted because he cannot spend a lot of time in ICU. And all the rituals and ceremonies, they're usually shortened, and all the rites are shortened, and sometimes the patient, the priest needed to wear a mask, and of course this means not enough oxygen. Sometimes the patient is not capable of understanding what the priest tells him. That is why there are peculiar features of praying. It should be done much louder than usual. You can use Russian language, normal Russian, or the church language. And the people who came over to us, they were trying to adjust everything to the needs of a patient, not just actually serve this rite or ritual, because actually as soon as we started welcoming priests on duty who didn't come to a particular patient but came to the hospital and just worked there as part of the staff, they started to be very attractive for the health providers. They actually wanted to do the communion, to come to them for consultation, and it became very important for many of my colleagues, for me as well. I'm not an exception. So such type of communication with the medical personnel and communication with the patients, not causing any negative outcomes. Very frequently, nurses were part of these rites and ceremonies, especially when it comes to the communion. Of course, no harm, that's the main principle for all of us. And I suppose that here we should take into account the spiritual sphere as well, because incorrect communication with the patient, wrongly or indifferently said words, correct in terms of the canon, but not correct in terms of personal communication, can aggravate the situation, aggravate the fear, not help but worsen or damage the patient. So psychologically correct words are utterly important. Of course, priests are not psychologists, but there are certain correlations between a priest and a psychologist, and indeed they need to be understood. And empathy, not imposing communication, and attempt to listen and understand. This is something that makes a priest and a psychotherapist very, very similar to one another. And as I see it, I suppose the priest has a more difficult task to help a patient to understand the purpose of all the sufferings that a person undergoes, and this communication with God and this feeling of immortality of soul. I suppose this is an opportunity of very, very deep humility and deep understanding. This is when a person really changes and really gets healed, both spiritually and physically. And of course, another great task is communication with the patient's families, because we were closed and families could not say goodbye or say that they were sorry for something. And the priests were just the bridges between relatives and patients. And I suppose that the role of volunteers and priests was just huge, immense, because the health providers don't have time for this at the moment. And we had very good particular examples, because some of the priests even communicated by media, thanks God. People after communion, after communication with a priest, they just got completely revived, spiritually revived, and they physically revived in terms of the disease. And such examples are multiple. We have these surnames, names of those who survived and got discharged from hospital, those patients for whom correct words of the priest worked really real magic. That is why, not to speak too long, to cut a long story short, I would like to first of all say that we understood how important it is for medicine as such, for the medical community, for those people who work inside hospitals, and for those patients who get treatment for any disease. Whether they're curable or incurable, we need to transform our understanding of a priest in the hospital. We should not actually understand that a priest comes only to somebody who is incurable and somebody who is terminally ill. No, a priest means soul, means spiritual guidance, and this is one of the lessons of pandemic that we need to understand, that we understood, and we need to continue developing these services. Thank you very much, Your Eminence, for the opportunity to take part in this interesting conference. Thank you, Marina. Thank you very much for your deep understanding of our role and of what volunteers and priests do in hospitals. It's clear that you do understand nowadays how priests function in hospitals. It's valuable for us as well. When I came over to your hospital for the first time, you told me that psychiatrists in the red zone are really missing, because that disease, in fact, impacts the psychiatric side of the matter. Now we have a psychiatrist among us, a representative of the chair of psychiatric health, mental health, who also works in one of the first chapels affiliated to the hospital. And I would like to say that it would be very interesting to listen from him. So, dear Vasily, you are welcome. Dear ladies and gentlemen, Your Eminence, I would like to thank the organizers of this conference and also for an opportunity to be one of the speakers. Maria Antonovna said a lot about the necessity of spiritual health for those who find themselves in critical situations. But when we come across patients of psychiatric disease, then actually understanding life values is always very topical, very important. If we speak about cooperation between Russian Orthodox Church and psychiatric community, then this cooperation in fact started some 30 years ago after the hospital chapel was opened, and back in 1992 we also opened another chapel. Just remember, it was 1992. Now every psychiatric hospital in Moscow and in Russian remote areas there is a chapel affiliated to it. This is absolutely wonderful at the moment. Then you remember 1992 hierarchy of values in fact was changed and modified, and in a year they opened the chapel, and in a year one of the biggest leading psychiatric hospitals also opened up another chapel, which was done by the decision of the leading psychiatrist of that time. And the decision was also approved in all the authorities in the Academy of Medical Sciences, and it actually happened. It was one of the most important events, and Patriarch Alexei, who took part in the ceremony. What does it tell us? And generally speaking, our psychiatrists, they always understood the necessity of a chapel or religion in psychiatric hospitals. And the process of sanctifying was actually very important, and it was a beautiful ceremony. Also, the presence of a priest is utterly important for the psychiatric hospital. One of our psychiatrists, a believer, told us that these believers, those people, they're much more confident. They're much more confident. This is something that psychiatric patients usually lack. And that means that doctors very frequently understand that the religious values, these are values that are utterly important for the patients. I cannot but remember one of the biggest Soviet psychiatrists, Professor Dmitry Melechov, who for many years in a row was the director of the Research and Development Institution of Psychiatry in Moscow. He said that there are peculiar features of psychiatric patients that, on the one hand, their anxieties can be manifestation of pathology, and on the other hand, it could be manifestation of just regular emotions. And anyway, he said that religion can compensate defects in the personality of the patient. He also stressed it very frequently that religion can be both positive, can be positive, and he considered that religion is a very potent psychotherapeutic factor for psychiatric patients. And I would like to say that the history of psychiatry is integrally related to the history of church. In many guidelines, we always have the, so to say, monastery stage, because our patients in the monasteries historically received huge support and treatment. The Kievo-Pechersky monastery, in fact, hosted a number of psychiatric patients, and they stored one of the first manuscripts in this particular area. I would like also to think back to the 18th century when our patients also were treated in monasteries. In Europe, they already had clinics like Bethesda in Paris, and those patients in Europe, then they nonetheless were resembled prisons for mentally ill and disabled. In Russia, it was different because all those patients were treated in monasteries. The first designated hospitals appeared in Russia in the 19th century. Maria has already talked about psychiatric component of diseases. And at the moment we speak about biopsychosocial spiritual model. This is the concept that was formulated by René Hefti back in 2003. And nowadays in many articles and in the Russian psychiatry, this concept is more and more quoted. What are we talking about within it? When we speak about the reasons, first of all, we speak about genetic factors, we speak about social factors, but also there is great importance of the loss of valuable values and the moral degradation. And we do understand that these valuable values and the dimension of spirituality that can be lost by our patients, these are dimensions related to spiritual values. They, of course, are very less frequently lost in those who are believers. We can think about Viktor Frankl, who spoke about the fact that religion gives a person the spiritual anchor for being saved, which cannot be found anywhere else. And he also said that the medical service of a psychiatrist, for example, can not treat the soul like a priest can. And first of all, therapy can treat the soul, but the target of the religion is to save the soul. If you look at the contemporary domestic Russian psychiatrists and those who work abroad, all of them write about the fact that the doctor must pay more attention to the religious experience of patients. That means that the psychiatrist, in fact, must take religious history of a patient and must understand what religious beliefs this patient or confesses. And at the same time, it is stated that the psychiatrist, unlike other doctors, must be informed about religious values of a patient, because he must be knowledgeable about the values, the confessions of this or that religions, what sort of beliefs and what sort of rites and rituals are implemented by this or that religious organizations. If we speak about Moscow, for example, and where the majority of people are confess Orthodox Christianity, then a psychiatrist must understand who the priest is and what the role of priest is. A psychiatrist must support the authority of a priest in the eyes of a patient. And of course, our cooperation with the priest is, first of all, our paramount goal, because we need to support each other. The literature sources also mention that we need at least an indirect dialogue between a priest and a doctor in each case of a psychiatric disorder. In a number of studies, also it is stressed that confession is utterly important with anxiety, patients with depression, anxiety disorders, and schizophrenia, especially in advanced stage patients. Also, it is stated, and it is proved by evidence, that lack of belief sometimes results in, or just disappointments in the beliefs sometimes result in psychiatric disorders. There is an American study that shows that psychogenic depression is directly proportional to the beliefs and religious beliefs of patients. Also, it is stated that those who believe they are much more motivated to support their spirit and also physical somatic condition. And high level of religious belief is related to stronger spirit, stronger will, and better confidence in just seeking for the aim in life, and as well as support of those who are around him. Of late, in the recent 2 years, we had two important events in the area of communication between psychiatric community and Russian Orthodox Church. So there is a very important document that was developed, which is called Pastoral Guidance of Patients by Russian Orthodox Church in Psychiatric Patients. This is a joint document between the Russian Orthodox Church and psychiatric community. This is a small document which is addressed to the diocese priests, who can read it and can open it up if needed. But it's a good, very good legal basis. It is first of all states that there must be certain training for the priests who want to do spiritual guidance in hospitals, in psychiatric hospitals, and a priest actually comes across not only with the psychiatric disorders and psychiatric patients, but also in the Russian Federation, just like abroad, he can come across other conditions. And if a priest comes over to a regular hospital, somatic hospital, then according to the studies, 30 to 40 patients who suffer from serious diseases, will be that oncology or CVD or any other area, they also can have mild concomitant psychiatric disorder. Very frequently, this is depression, and sometimes depression that occurs in somatic diseases can aggravate the somatic condition itself. So the priest very frequently deals with psychiatric disorder, and that is why this document outlines practical guidelines for priests when these patients should be referred to a psychiatrist, when there are suicidal moods and very severe psychosis, for example. Also, it says that priests should perceive, explaining it to the patient that he needs psychiatric help and assistance, help the patient to understand abnormal behavior. I remember one very important priest in Moscow, and his spiritual daughter. She had exacerbation of psychiatric disorder. He actually helped her to be hospitalized to our hospital and in our clinic. We also have wonderful priests, and in 2 days, I received information that this priest came to her for the communion. He did not just refer her to the hospital, but he didn't leave her there. He came over to her for the communion. That was something that stunned me really. Priests must also educate the diocese and the parish that psychiatric patients are regular participants of their community. Because they are part of the community, otherwise they will not have a chance to be linked to the community. So the priests should support not only those who are diseased, but also their family members. Another very important event that happened this year, This is a guideline for students. This is a standards of spiritual guidance. It's a theological manual for students, and the priest must, it also states that the priest must know at least basis of psychiatry. There is a separate chapter on this. The same year, also, there was another publication, manual on psychiatry for priests. And in a number of educational facilities, starting from the end of the previous century, there is psychiatry that is taught to priests, just like psychologists need to know clinical psychiatry, the same is relevant to the priest. This is something that is taught in Moscow and also in other educational facilities in Voronezh and in Novgorod, for example. I must also say that one of the first guidelines was developed back in 1928 in Germany, in Heidelberg, and later on it was revised in 1945, and an American Psychiatric Association also published a manual on psychiatric health for the priests. Another very important event happened in our psychiatric environment by the Russian Society of Psychiatrists in St. Petersburg. In March, they had a meeting, and they also discussed, there was a section on clinical psychiatry, religion and spirituality. So they systematized clinical psychiatry, religion beliefs and spirituality, and they considered that they need to disseminate this sort of knowledge to wider community dealing with patients. So on the one hand, we need to educate our psychiatrists and doctors in terms of religious values. We need to understand more our patients. They must be respectful of religious beliefs in our patients, and we need to support our patients in the research into religious values. So a psychiatrist, but on the other hand, this is just a responsibility of a psychiatrist. And on the other hand, the mass media sources, status, and also the priest must know a lot about psychiatry. Our center has a modest experience of cooperating with the church. We also have good cooperation with different confessions. It's a modest experience, and I hope that our psychiatrists will have contacts with other confessions, a wider circle of confessions. Our experience of cooperating between priests and psychiatrists within 30 years, it has been accumulated both in my center and in the military medical academy in St. Petersburg, as well as many hospitals in Moscow. We have good cooperation with priests in Moscow and other cities of Russia. So the thing is that we are cooperators in terms of caring for our patients, and very frequently the priest is exactly the person who the patient addresses first, sees first, and the priest, in fact, detects the psychiatric disorder. A lot depends on how the priest behaves and what the priest knows. It's not just the spiritual saving, but also sometimes it saves lives. And we have many examples when a priest, during the confession, detected not just depression or suicidal moods, but the presence of very important suicidal intentions. And so the patient was actually ready to go and terminate his life. We have a beautiful, wonderful priest, Lyadikov, who works in our chapel. he once remembers that one of at the confession, one of the women confessed that she had she felt very bad. And he said, I started asking more questions. And she said that the only way out was committing a suicide. And she actually decided to commit a suicide together with her daughter. I communicated quite long with her. And as a result, the woman voluntarily went to a psychiatrist. She got treatment, and at the moment, everything is all right with her and with her daughter. And such examples are multiple. So in terms of our cooperation with the priests, we very frequently communicate over particular cases. For example, the patient don't want to take treatment, to get treatment, to take medication. There are certain things which make his or her condition very peculiar. It's very important for the priest to support us. And very frequently our patients take medication and come to get treatment only because the priest actually sent him to a psychiatric clinic. But the priest, I thought they say that I had some spiritual problems, but the priest told me that I need to go to the doctor, and actually so I did. So psychiatric health is the area of our joint responsibility between us and representatives of the Russian Orthodox Church. Thank you for your attention. Thank you very much, and thank you for inviting me to be part of this very important conference. Thank you. Thank you very much. Thank you for participating in this conference and for the work over the books that you recently published. So during this time that we're living in.
We have to translate this is joke into English, because it will be joke in Russian. Says our days during the COVID, they say it's important not to survive, but not to get out of your mind. This testing with lots of psychiatric mental disorders, it's not possible to handle it without psychiatrist care. Dear friends, our meeting is called Spiritual Care of the Chaplains and Medical Facilities, right? Psychology and Organization. And we're glad to give a floor to Alexander Popkov, the legal advisor of the legal department of the Moscow Patriarchy. And so your talk will be most interesting for us. Thanks a lot, Your Grace. Your Grace, Panteleimon, the participants of the conference, I would like to greet you all at this conference. I would like, first of all, to say that the Russian Orthodox Church has both historical and modern experience, the search of hospital chaplains and other participants in the church in various medical facilities. And talking about the modern stage of legal regulations, then the law of the Russian Federation, at least the federal law on basics on the health protection of the citizens of the Russian Federation, stipulates priority of patient interests when providing medical care. It is provided along with following honoring religious traditions and beliefs of the patients. According to the law, a patient has a right for the priest to be allowed accessing him, no matter where the patient is located. This federal law also has a statement on the need for medical entities providing palliative care to interact with religious bodies and entities, including provision of spiritual care. I should say that the current legal framework in Russia has a requirement to provide rooms for religious rights, and thus it makes possible to organize prayer rooms, chapels, or churches in hospitals. And the law on the basis of protection of the health of the Russian citizens stipulates that if a patient is treated as inpatient, he or she has a right to be provided proper settings for religious rites and ceremonies, which can be done and performed in inpatient settings. Our federal law on freedom of consciousness and faith also stipulates the right for religious rites and ceremonies in medical facilities related to hospitals. I should also say that today legal relations between medical and religious bodies with regard to placement of chapels or prayer rooms could be executed through the agreements on cooperation. It's stipulated in the letter of the Ministry of Healthcare, and such agreements are executed with canonical units of the Church, both on federal and regional levels. Religious, as to the oral agreement with the hospital administration, religion organization sends its so to say priests according to the pre-planned schedule, but in some very rare cases, the building or the rooms in the medical facility are given in the free of charge use to religious organizations, and this situation, the agreement, the use it assumes that they would conduct all necessary refurbishment. So the Russian Orthodox Church interacting in general with healthcare ministry, it is based on concordant basis. In particular, it was executed agreement on collaboration between the church and the ministry in 2012, and just yesterday it was executed agreement with Russian Orthodox Church with Federal Medical and Biological Agency. But I would like to draw your attention to the following. In general, in the Russian Federation, at the moment, religious and spiritual support is provided by, so to say, clergy in various places, in army, in prisons, in hospitals, and staff positions of chaplains are, so to say, occupied both as military chaplains who worked as commander heads, commander assistants, as well as as a priest who could serve as assistants for for instance, penitentiary facility heads, and the Institute of Military Clergy was introduced, providing special positions for priests to work as assistants to commanding officers. And the Russian government introduced the rule for priests that they should undergo special training for that activities. And in general speaking, the Russian Federation, lots of efforts were done to introduce the institution of military priesthood, and they so priests work as so to say as assistants of military in military facilities. Also the priests work in penitentiary system through concordant agreements on collaboration of the diocese with the federal service on penitentiary federal service. And so chaplains can work as assistants for the heads of the territorial organs of penitentiary system. It is said in the statement of the government of 2007 on payment to the staff of federal penitentiary organs. Along with that, at the moment, hospital chaplains having a legally fixed right to have access to the patients in hospitals and providing hospital ministry to the citizens. And as His Grace mentioned today, they still do not have the support from the medical facilities, so they are not so to say officially recognized as hospital priests, as hospital chaplains, unlike in many countries of Europe and in the States. And with this regard, the exchange with experience and knowledge with our foreign colleagues presents great interest and the hope to develop cooperation and collaboration with that regard. Thanks a lot for your attention. Thanks a lot. Dear Alexander, we hope that the legal department of Moscow Patriarchy will further develop regulations on possibility for the priest to be present in hospitals, and without your assistance, of course, we wouldn't be able to do that. I'm sure that the government will help us with that, and Ministry of Health actually think about that. So in the nearest future, we'll have to develop the way how we can interact and collaborate. So people who stay as inpatients, they should be independent from the opinion of some head physicians. So the right for patients for freedom of faith, it should be mentioned not only in the Constitution, but also it should be, so to say, regulated by various enactments. So, dear participants of the conference, we're seriously out of time, and we didn't think that the conference would last that long, that our interpreters have could work only until 4 p.m. So would like to say that the questions which were asked on YouTube, we want these questions to be voiced right now before to elicit other talks. And one of the questions is actually addressed to Mr. Chad Maxey. I would like to read it. It is the question from Yelena Pimenova. So she asked, so telechaplaincy, what is it? Is it a kind of a trust line with chaplains, or what is this? And another thing she wrote, the veterans is quite a small piece of the populations. So these telechaplains, do they take phone calls from everybody in need or only from veterans?
So our telechaplaincy will take calls from anyone. Nobody's ever turned away. We provide care for everyone, but our primary focus, of course, is on veterans, their family members, and VA staff. We also provide funeral services at the national cemeteries on occasion, as requested by families as well.
And telechaplains, what does this mean? It is just assistance by the phone? Can you, or is there some cause, any other types of interactions are possible?
So we do telephone, of course. That's probably the largest portion now during COVID, but we're doing a lot more video conferencing with veterans and family members during this time. That continues to expand. One of the challenges has been on the veteran side, because many of our veterans that we care for are older and are not quite as adept with technology. And so it's been a challenge for them to adopt some of the video. So many prefer the telephone.
Thanks a lot. We had experience of setting up such conferences in YouTube, and we announced it will be YouTube broadcasting for patients and for relatives, and we had about 100 of participants. It was very successful, so we should continue with developing this type of communication. Thanks a lot. Any more questions? Yes, there was one more question to Mr. Maxey. What are the sources of funding the chaplain services? Isn't the funds coming from the state budget, or from the or the funds comes from, so to say, their confessions?
All the funds for VA chaplaincy come from the federal government. We we receive donations at times from different people and organizations, but all the salary dollars for chaplains come from the federal government.
Thanks a lot. So Vasily, more questions? We had also a question to Professor Hausman. If she's there. She's off. I'm afraid she's off. She's not. She's disconnected. So maybe then. So no more questions to. There's no questions to Father Daniel. We don't have any questions. And general questions, I don't think we will have time to answer all of them, but all those questions. So we don't have any more questions on chaplaincy in other countries. All the questions are about Russia. Yes, most about Russia. Do you have more time for, maybe you have any more questions for our foreign guests? So maybe then let's listen to the presentation of Father Nikolai. So yes, please bless me, Your Grace. So your experience is very interesting. So we're out of time. We will talk with you also to tell us about your work. So please. So bless me, please, Your Grace. Good day, dear participants of the conference. The diocese of our church is located in the city hospital of the small town of Azov in the south of Russia. Our diocese actually has some activity. Our sisterhood has more than 80 participants. It is the Sisters of Charity and their assistants. But COVID for us created huge constraints and limitations. And the spring of 2020, we opened the COVID hospital was opened in our town. And by the end of the year, we had 3 COVID hospitals and ICU. So that's why we needed, there was a need for spiritual guidance for patients in hospitals and at home. At first, it was hard to organize a collaboration, communication between doctors and priesthood on issues, on possibility to visit COVID patients. Currently, I do have this opportunity. And what facilitated the possibility to visit patients in the red zone? First of all, it's a high-level interaction with the hospital administration related to the significant activity of our diocese. This decision to allow priests into the red zone was made in a very, so to say, cautionary way. It was happened only after the April 2020, after the regulation scam from the Patriarch Department on the service of the city metropolitan and on rights and COVID units. Also, we participated in online conferences and workshops organized by the Synodal Department on charity and social servicing, social ministry, dedicated to hospital ministry during the pandemic. So hospital ministry is continued to be provided today in these hard days. With the beginning of pandemic, our Sisters of Charity visited all patients in hospitals. They provide spiritual care, help to prepare patients to rights and cared of severely ill patients. In the settings of COVID pandemic, it became possible to resume hospital visits only after nurses were vaccinated and their immune status was confirmed. Some of our Sisters of Charity with medical education actually on their own decided to work in hospital red zone as nurses, as medical nurses, caring over patients. For instance, our sister Yelena Zavgorodnya, quite recently, she was awarded with a special award of gratitude from the governor of the region on saving lives in the COVID clinic. In the November 2020, during the considerable increase of the epidemic morbidity, our hospital required oxygen concentrators. Our Azov city, our city department or diocese actually managed to organize the event, and we collected money for this equipment. And then our diocese organized as a territory of the hospital activity, and since October 2020, we started to provide the hot food to medical staff at the COVID clinic. And today we prepared and provided to medical workers more than 10,000 of hot dinners. And currently, with request of patients or their relatives, I can visit without any problems the red zone to fulfill my ministry. I would like to mention the specific, so to say, touching moments when the patient is in ICU and relatives cannot visit him, and I transfer this connection, the words of support. And sometimes this support and words turn to be the last words for the patient's life. And so by accepting these holy gifts, the patients can get access to the help of assistance of God. It's important to mention the help which people gain through the hospital ministry. For instance, in April 21, relatives of one woman with the name Ludmila, she asked me to visit her in the hospital. So I called to the doctor, and I asked him if the patients in the room would they accept administering the sacrament. And after some time, doctor called me and told me that 25% agreed on this. And as I understand that at that day, I did a community for all the patients in that unit. And I would like to give another example on providing care in saving a person. Once I visited a woman with the name Nadezhda, who was in a very severe condition, and she, for a long time fighting the disease, she actually almost lost all strengths to fight the disease, and she decided. Doctors thought about connecting her to the mechanical ventilation, but after the servicing, she actually managed to restore. So currently, she participates in our work, participates in all the so to say events we organize, and she follows and she looks at everybody who follow all the sanitary hygienic norms and wearing masks and other individual protection means. Sometimes they invite me to visit. They ask me to visit the COVID unit, but invitation comes not from relatives, but from medical professionals. They come to God and in their praise, and they're very glad to see priest. And also they say once a priest visits a patient, the anxiety goes down and they turn to be more spiritually stable. Medical staff, they have a very considerable professional burden. They don't have much time to talk to patients. So the good word, it works like a treatment. It's not just provides consolation, but also provides confidence that the treatment prescribed by the doctor is actually is an act of will of God, of implementing the will of God, and outcome of treatment actually depends on the faith. Every person treated in the COVID clinic, for everyone, it's very important to implement his or her right for the freedom of faith. It's very good to see how the hospital ministry is being developed in Russia. Historically, in our country, before the revolution, it was really well developed institution of hospital chaplains will make possible our ministry to be systemically independent and not connected to the attitude of, so to say, from will of other people or some kind of officials. It would be great to know if the institution of chaplains will be connected to the institution, to the healthcare ministry, so the chaplain would be responsible to his or her confession. So that's experience which we heard today at this conference, I hope, would introduce some changes in our country as well. I was very glad to hear today very interesting ideas and examples from different countries of the world. Today, we are united with a desire to do acts of mercy, acts of charity, and it's very important for all of us. I would like to thank you for your attention, and I would like to say that the majority of things I wanted to say in my talk, they were mentioned before me in previous talks, and it says that today's conference is quite different and it shows the very good example of unity of thought. Thanks a lot, Your Grace. Thanks a lot. We see how these great examples which you mentioned, they're very important for everybody, how they affect soul and people. Thanks a lot for your ministry. We do heard about lots of similar examples, and we know about those miracles that happen. Thanks a lot. It's very important for us. Thanks a lot once again. Vasily, do we have any more questions to our participants? Yes, if I may, I would like to ask one more question, and then we will give a floor to Roman Lukin. So actually, there were several questions about the difference between the approaches in the Western countries. They used to call chaplains not the clergy people, not the clerical people, but also volunteers. They're also called chaplains. So, to what extent this term chaplain could assume clear definitions of what does it mean to be a chaplain? So maybe we should somehow so to say maybe we should so delineate. Maybe we should say there's a hospital ministers and a chaplain. So there could be a clergy who serves the hospitals and those not clerical people who can serve as chaplains. So Father Daniel, what do you think about that?
So, in Italy, there is the possibility to work in a hospital, especially by priest. But in North Italy, Trentino Alto Adige, there is a big amount of lay people that can work in hospitals. So nuns are working like nurses, but not like a pastoral care, but like a volunteer, not assumed by the hospitals. Is difficult for now, but I think for the future will be change the opportunity, and comparing to the other nations, there will be the possibility to assume their people to make a part of the chaplaincy. And I hope for the future, chaplaincy or ecumenical and inter-religious chaplaincy.
Thanks a lot. Mr. Chadbaksy, what do you think about that? What do you think about that question on separation between clergy and lay people in chaplains?
Well, we don't have really a distinct separation in that sense, but because we have our own faith traditions that we bring to the chaplaincy. But I think because we were really born out of military chaplaincy, where the chaplains are expected to provide care for everyone of every different kinds of faith in some form or fashion. I think that that's kind of made, at least in the minds of the people that we serve, a kind of difference between a pastor of a local church or a priest than a chaplain. And I think that people expect that the chaplain will be more open to maybe different kinds of religious experience and ideas. Whereas if I'm Baptist, so if somebody came to me as a Baptist pastor, I have my own defined kind of ideas of what religious and spiritual care is. But as a chaplain, we learn and grow and try to develop a wider sense of what the spiritual needs of people are. And I would say that in most healthcare systems in the United States, they do use volunteer chaplains that do not meet the kind of requirements that we have in the VA, but the VA does not, but other healthcare systems do.
Thank you. Thanks a lot. I think that it's not, of course, a question of terminology, whom to call a chaplain, a clergy or a layman. We have our wonderful sisters, whom Sisters of Charity, we also call them chaplains. It's a foreign word. We have lots of words coming from English, like fundraising, crowdfunding, and others, many other words. We had, of course, we had a word of special word for that. I think it's a hospital priest. Or when I come to the hospital, I do not ask. I'm coming to the patient. I'm not asking who is this person. Is he a Muslim or Orthodox or Protestant church? We talked to Buddhist. We had a woman from Sri Lanka, from Anglican church, or anyone. And then, if also would like to ask something about the Orthodox church, I'm very pleased to talk about Christ without getting into some confessional differences. There is a very good book of the English writer, Just Christianity, if I properly translated it. We have lots in common, and for a patient, he wants to find out about most important things. And I'm very thankful for our interpreters, so they agreed to continue with their working day. And I would like to ask Roman Lunkin to make a talk. He's Deputy Director of the Institute of Europe of the Russian Academy of Sciences, head of the Center of Study Problems of Religion and Society. But could you please shorten your talk if possible, because we're really out of time. So, and your talk initially quite interesting. It's going to be a kind of a summary of our conference. And with Roman, or Institute of Europe of the Russian Academy of Sciences, and Ministry of Healthcare of Russia, we plan to publish the collective works of the presentations on the results of the based on the results of the conference. So, Your Grace, dear participants, for the possibility to talk, it was quite interesting for me to listen to all the talks at this conference, and they develop a very, so to say, high-level view on the chaplaincy in the Russian Orthodox Church and in other countries. And I hope that it will finally make possible to prepare scientific academic work, which will be published under the auspices of the Russian Academy of Sciences. And for my talk, I decided to call it Social and Historical Value of Hospital Ministry of the Church. Could the society do without solidarity and so to say, and solace? But you know, it's possible. But sometimes try to do without it, without the mercy, and the state system also is trying to do without mercy. It provides all the medical services, other services, but the source of solidarity and mercy could be the church per se. And briefly, in a very and in a kind of a synopsis way, I would like to talk about the social role of the church in the Russian society and about the role of the foreign experience for the Russian Orthodox Church. The matter is that the hospital service during the last 30 years developed in a very well developed service for clergy and laymen, and the whole range of movements and department on the social service, and personally His Grace Panteleimon turned into the driver for development of social service of Orthodox Church in hospitals, and working in various hospitals like hospices and others. It turned to be a very important impulse for understanding the social role of church and in changing society and in involvement of, so to say, parish people to the social services. We noticed that during the last decade, we noticed not only church can change, but also church can change the society around it. And when I read about history of various social initiatives of the Russian Orthodox Church before 1917, of course, on the verge of the 19th and 20th century, there appeared lots of various missions and social service, social ministry appeared, which looked close to what we see these days, but to the modern days, to the current days, the closest one is not some separate social missions like a minister of clergy in the hospitals, because every hospital has its own chapel or church or temple, but social missions were the closest to that, which Orthodox Church hasn't. So, for instance, some Siberian, Altai, or Kamchatka missions, they were started from scratch, and mandatory they organized social ministry in hospitals for everyone, and so they created a set of social services. And the church, in order to start effective social ministry, the church needed to set a good contact with society around it. And something similar happened in the post-Soviet times. It was where we needed to overcome some kind of a social, so to say, lack of social trust. And so the social ministry to provide consolation and to help became to be important in the 1990s. And to a significant extent, the success of the social mission of the Orthodox Church depends on the ability to communicate. Today we see huge diversity of forms of the ministry. There are lots of them, as we discussed today. And I would like to stress the experience of some regions in Russia where regional government supported social ministry of the diocese, and in cooperation with administration, the clergy people were just, so to say, fixed to some specific facilities, medical facilities. So such joint projects I saw such joint projects of the church and governors, like in Belgorod region, in Tver region, such projects were implemented, and so on and so forth. So in Russia today, at least look at the statistics which I checked, we have more than 5,000 hospital entities with more than 1 million of hospital beds and about 30,000 clergymen and 19,000 of Orthodox organizations. So currently we have a very important and strong basis for that type of service or ministry. And pandemic, naturally, at the time of crisis, it's, so to say, it's pushed us at the time of pandemic and crisis. The fear of the future, of course, develops, and it's very important to pay attention to hospital ministry and introduce the institution of hospital priests or chaplains. And of course, it was well prepared by the previous social ministry and activity of the church. Also, I would like specifically mention the contribution of volunteer ministry and volunteer projects all over the country, because for hospital ministry, presence of volunteers and possibility to involve them in more or less in a, so to say, massively, it turned to be a kind of a breakthrough, because today, as we mentioned in various talks, hospital ministry, as many other forms of social ministry, is not just something like communion or mental health, so to say, or soul care, but in this case, hospital ministry gets its own value and role. And also talking about the following, when the representatives of church started to nurturing people, such things like a social responsibility and empathy, then social service started to look more like foreign experience, because there we see multiple various forms in various countries. And since today Russia is more or less trying to, so to say, associate itself with the European Union, there are lots of stereotypes about the secular state of power, what should be the role of religion. And we should say, the European Union, within the framework of the Lisbon Treaty, they admit specific relationships with religious organizations or entities. It's a special, it's considered to be like a special dimension. And also they admit the right of various nations, various countries, to create their own system of state church relationships, their own concordance, where they define status of clergy working in army, in schools, and in hospitals. Well, the search for the necessary level or wave on communicating with people is one of the main topics of the book of His Grace Panteleimon, and it was a very important topic for various presentations. It's very important for just and solidarity society, for healthy or reconvalescing people. The state is interested in providing, if the country is not, if the government is not interested in providing high quality, state is aims to provide, so to say, treating the physical problems, but spiritual case provided by the church, where the fear of pandemic is next to the fear of the digital space. Yevgeny Vodolaskin, a very well-known Russian writer, in the beginning of the pandemic said that after such an era of building up various borders and sanitary cordons, surely the time for hugs and embracements will follow. Should follow. Thanks a lot. Here again we see Professor Hausman. She joined us, and Dr. Hausman. We regretfully have only English translation at the moment. So if you can hear us well, I hope you can hear us well. So we have a question from one of the participants, and we would like to ask you that question. The question is the following: is it any all-German conference or assembly of chaplains, which includes representatives of different confessions? And if is there such an assembly, then what actually it is doing?
Thank you very much for contacting me again. I hope it's fine if I answer in English. Thank you very much for this interesting question. I understood that you wanted to know whether there's an assembly for different religions and ecumenical cooperation and how they work together and what's their purpose. We have actually a lot of assemblies from the Protestant Church first, and we're cooperating with the Catholic Church as well. And in our study, we also included some of our Catholic friends. So we have a very close cooperation between the Christian dialogue. And currently, there's a huge development concerning the Muslim pastoral care too, which is a big development in Germany at the moment because they're implementing structural opportunities to train their staff according to the rules and obligations we have that they can take part in institutions like hospitals and so on. So we have a very close cooperation. There's a long dialogue going on. We have assemblies, so to speak, on the institutional level of university dialogue going on, and we have an institutional cooperation between the churches in the interreligious dialogue going on. So there's not one single assembly to my knowledge, but we have different conferences and we speak on those levels and try to establish how to deal with the pandemic too. So it's an ongoing process, I would say. And I hope that answers your question to some detail. I just like to add, I think it's more complicated on the different levels to find a good cooperation together. And what we have learned from our study is that on the very basic level, the cooperation is going on in a very good way on the level of hospital chaplains themselves, who tried really to cooperate with their colleagues and try to reach those experts from other religions and try to really make their support available for the patients who need it at the moment of their spiritual advice services. So I hope this could answer your question to some extent.
Thanks a lot, Your Eminence. Excuse me that I interrupted you. Yes, please, Vasily, if there are more questions, you can ask them. So thanks a lot, there, Dr. Hausman. Thanks a lot, Dr. Hausman. There was a question to Mariana Anatolovna. May I read the question for you? One of the participants in YouTube asked, are there any observations? That's a question to you directly. Are there any observations like pandemic affected doctors? Are there any cases of first conversion in the settings of pandemic among the medical professionals? Yes, surely. And actually, it was said that many people expressed this desire, and they came with a desire to the priests visiting our hospitals, visiting our hospital shifts. And I know that more of our colleagues started to go to the church, to services. Regretfully, we don't have our own chapel. We do dream to have it, but this project is still a project. But there was such a need, and many people do change their attitude and, so to say, requests. And so these requests are still there. Thanks a lot. Vasily, any more questions? So I'm sorry, we do have lots of questions related to the problems of getting into the hospital, about the access to hospitals, and we not to voice out of the questions. We can pass the questions to the Ministry of Healthcare. We can promise to our to our audience that we will ask those questions to our Minister of Healthcare, because these questions, of course, should be monitored properly. The situation should be properly, so to say, resolved. Out of the questions I see, I think we've discussed most of them, most of the issues. So maybe we're ready to wrap up. And there was one of the issues about the difference between psychology and psychiatry. I think we can hardly answer this question right now and discuss. So generally speaking, the main portion of all the questions were asked. Thanks a lot, Your Eminence. So, dear friends, I would like to thank all the participants, and especially I would like to thank Mr. Chad Maxey, that you from 4 a.m. from the early morning, you're still with us. You never switched off. You didn't drink, you didn't eat. You stayed with us and listened. And thank you for wonderful presentation, for your wonderful participation. So we can see that COVID not only separated people, not only brought patients into red zone, not only lockdowns emerged on the world or around the world, but also it joined us together, united us. So this testing from God comes us not to stay discouraged and in despair, but to get united, to become stronger, because it multiplies love and unites people. And I'm very glad, my dear friends, to hug you, to embrace you, so to say, online in virtual way. So I'm hugging you all, and I'm cordially thankful for you all for your participation in that meeting. I have a very, very joyful day. Thank you a lot, and I hope we will continue those meetings in another conference of that type. And of course, we're going to welcome all initiatives on setting up contacts to help to all of those who are in need, suffering, who are dying, who lost their relatives and close ones, and who need our help. Let God save you all. Thanks you all, and goodbye. Thank you all for organization and for the event. Thank you. Thank you all, Your Eminence. Thank you all, and goodbye. Thank you, and wish you good health. So as a captain, I will leave our platform, the last one. And you can switch off one by one.